Testing? Yes, it's working. Thank you. Good morning, everyone. Please take your seats. My name is Alexandra Topalian. I will be your Master of Ceremonies, and I'm delighted to welcome you to the Health 2.0 Conference 2023 edition held in Dubai. I'm thrilled to welcome you all to this highly anticipated event. So get ready for an unforgettable experience packed with invaluable insights and opportunities for you to network with your peers. This year, we've raised the bar even higher, bringing you an extraordinary lineup of healthcare professionals, thought leaders, and innovators who will revolutionize the way you think about the industry. And a friendly reminder to all our amazing attendees, we do want you to participate. So if you take pictures or if you have comments to make, please don't forget to hashtag Health2Conf. Hashtag Health2Conf on social media, and please do tag us. I would like to remind you that if you are a speaker today, there will be a timer set for you, so please be mindful of the time you have left. And if you'd like to take some questions from the audience, then do leave the last 4 or 5 minutes for that. All right, ladies and gentlemen, it's time to dive into our first session. And it is a game-changing session on innovations in healthcare delivery, prevention, promotion, and cure. From pioneering preventive approaches to impactful health promotion initiatives and revolutionary cures, this session inspires and empowers you to drive the future of healthcare. Please welcome our session's moderator, Mr. David Rowlands, Managing Director of Digital Health Leadership Australasia. Welcome, Mr. Rowlands. Our panelists for this session, Ali Tinazli, CEO of Lifespin. Welcome, Ali. Yasmin Samatar, co-founder of Mawada. Welcome, Yasmin. Next, we have Dominique Goumelt, well-being expert and lifestyle medicine entrepreneur at Living Alive. Please take your seats. And Prashun Chatterjee, CEO and founder, director of Curis Concept Consultancy. Welcome. Let us set the timer, please, for the panelists. And Mr. Rowlands, the floor is yours. Mr. Chatterjee, if we can leave the first seat for Mr. Rowlands. Oh, you're going to stay here?
I'm going to stay here.
You won't be in the video, just FYI.
All right,
okay.
In that case, I'll sit there. So could we have the first slide, please? Thank you. Yep. And there we are in all of our glory, except that, I'm sorry, we've only just discovered that Yasmin was a part of this panel, so that's why you're not mentioned there. No offence, we apologise. So we're going to be talking about innovation in healthcare. Now, before we get underway, let's get one thing very clear, and that is that everybody in this room is an expert. You wouldn't be here unless you were. So we actually want to hear from you as much as you want to hear from us. So we'd really like to have an interactive discussion. We're going to ask a series of questions, make a series of comments from the podium, and then we'll open up for some discussion, and then we'll come back with some more discussion from the stage and finish up again with some opportunity for audience interaction. So get your questions and comments going, please. We really do want to hear from you, and I think we'll all enjoy this session much more if it is interactive. So, tick excuse me, to kick us off, Ali, you are innovating in the area of precision medicine with a view to making it more accessible and affordable for everybody. So please tell us about Lifespin.
Hello, good morning everyone. At Lifespin we are digitizing blood. How does it work? We take a blood sample from a patient, we scan it within a magnetic field, and then we can obtain quantitatively hundreds of metabolites which are in your blood, which are representative of your health status. We are developing AI-based software algorithms which can detect disease-specific metabolic signatures. We have about 300 diseases in our proprietary database. And now we are launching subsequently our initial products. And how exactly does it work? First of all, the metabolism provides a direct insight into your health. So when you can look into your metabolism, you can basically look into your health. What's important is, in terms of personalized and precision medicine, that many solutions which are commercial today are too expensive for widespread use. But on the other hand, you can only have population-level impact if you have affordable and scalable solutions. And our strategy is basically to team up with local health system providers and laboratory chain companies in different countries in the world, then to enable these partners as scaling partner by making our software algorithms accessible. The patient logistics will remain always locally. Because of that, the cost structure can be extremely low. And I will give you a keynote actually later this afternoon at 2:30 about stroke, where I will present in more detail what exactly we are, or how we are achieving this.
Okay, Dominique, you work and live in the world of well-being and lifestyle. Tell us about innovations there.
Yes, thank you. Can you hear me? Yes. Good morning. I'm really happy to be here with you all. And David, just as you said, it is so interesting to see where we are on this day in terms of lifestyle. And it is actually crazy because I think most of you know the statistics, and I'm not going to give a whole presentation on that, but just briefly. We know, for example, now that 2/3 of all diseases worldwide are caused by lifestyle factors. We know, for example, too, that healthy lifestyle can prevent disease and actually lower the risk of chronic disease by 78%. So statistically, we could talk about a lot of things. And so clearly this has led to understanding the importance of lifestyle medicine. And David, that is the innovation. The innovation is really lifestyle medicine as its own actual area within healthcare. And maybe you have not heard of this expression, but lifestyle medicine formally organized in 2004, and only just a few years ago, we now have the Global Alliance for Lifestyle Medicine. And so within that scope, there are lots of innovations happening as we speak, particularly tied to digital and mobile health. I think if I ask you, maybe I ask you if that's okay, which one of you wears a fitness tracking device or a watch? A lot of you, exactly. These are all part, of course, of the innovations within this landscape. And so one of the projects that is emerging in just the last year or two, as data has been collected over the last 5 years, is a project, an innovative project within lifestyle medicine called the LIFT project. It aims to lift 10 million lives around the globe for better health and well-being. And so I'm very delighted to be a part of this landscape, because this innovation is transforming lives on all areas of health and well-being. So as we talk about, you said well-being, of course that includes not just physical well-being, but also social, emotional, financial, etc. well-being. And so the LIFT project is a holistic approach to lifting lives, to preventing disease, and of course, as it results in also a much lower cost for health and healthcare system. So this is one of the key elements, and so I'm looking forward to talking about this more.
Thank you. And That's a good segue over to Prashun, who's going to talk to us about health promotion. What's happening in terms of innovation in health promotion, Prashun?
Thank you, David. Hello, can you all hear me? Yeah, thank you, David. My background goes into, I'm into healthcare, managing hospitals as an administrator, and definitely incorporating this new innovations coming into every day into the business. That's the biggest challenge, what we are doing. But today, if you see, COVID has taught us a lot of things in terms of innovation into healthcare. The first thing that comes is the telemedicine. You know, telemedicine has made us reach to the remotest place with the specialist doctors giving treatment. Even the adoption of mobile for various kind of awareness programs, self-tracking, and connectability of mobile with wearable devices, which Dominic just mentioned. Like most of us are today wearing wearable devices as a health tracker, which is again connecting to mobile data for us and for the others also to understand. This was not there earlier, and this is something which is catching up enormously in today's world. Next is the artificial intelligence and machine learning, which is churning out various data to understand patient profile and adaptability and what Ali just mentioned about adaptive medicine. So these are the various things which are coming up in innovation, and I feel innovation, a continuous innovation in healthcare by all the industry organizations is very important, because otherwise you become redundant in tomorrow's world if you don't catch up with the innovations that are coming up. If you take examples of several other industries, like if you see music industry, once upon a time we used to listen to music on cassettes. Then came the world of CDs. Then it was then MP3 came and we had music carried in MP3 format. And now it's available freely everywhere in the internet. So if the industry doesn't change with the technological advancement, those who have not changed will be left behind. So similarly, healthcare, whoever is in whatever practice of healthcare, needs to upgrade themselves, keep themselves with this technological advancement to innovate and adapt those innovations in their own business so that they can stay abreast. Thank you.
Thanks, Prashun. And now, Yasmin, you're a respiratory physician working in the area that has gained so much attention over the last few years, PPE. Tell us what you're doing.
Okay. Are you guys able to hear me? I have a very soft voice, so my name is Yasmin, and I'm one of the co-founders of Mawata, as well as my co-founder over there, Furley Adam. We're both respiratory therapists, and we have founded our company, Mawata, which is a modest medical clothing company. And we launched our first patent project, which is a disposable hijab. And kind of to give you a brief overlook on how we came about, as respiratory therapists, graduating about 6 years ago, going into our first operating room and being precepted, I remember my preceptor telling me, since we're going into an operating room, that it's sterile, to tuck my hijab in. So I'm going in as a newbie, trying to tuck my hijab in, and as soon as I get in, the nurses are a little bit more cautious, and they're telling me, tuck your hijab in a little bit more, and I'm doing that. So during the whole procedure and going over my skill sets as a respiratory therapist, I'm more cautious about my hijab and impeding my patient's safety and bringing an infection into the room. So by the time I leave out of the room, I kind of felt a relief, right? And that's when our coworkers and I, that are Muslim women that wear the hijab, kind of briefly talked over it. And as newbies, you're not thinking, let me create something, let me invent something, right? So we're thinking, let's just bring our hijabs in, a new one to the room each time we're going in so we can prevent that. And then we deal with more instances, just like going into a code blue situation where we are helping intubate a patient or doing compressions, and you have blood splatter all over you, and you don't have a new hijab to go into the next patient's room, and you don't want to impede that patient's safety. So we're calling our family, our friends to bring us more hijabs. And then as we're trying to kind of put a Band-Aid on the situation, that's when COVID came. And during COVID, before you're going into the room, you're all gowned up, and then you enter the room, and we're dealing with high-intensity situations. We're dealing with trying to monitor the ventilators as well. So dealing with all of that and then leaving the room and ungowning and still having your hijab on, and then going into your next patient's room for the next 12 hours. And some of our patients are cancer patients, some of the patients are in the NICU, and we don't want to bring that infection over to the next patient as we're going in. So we had to tell our managers, like, can we not go into the NICU, because we don't want to bring that infection to the newborns. So as we're going about that, that's when my co-partner, Furley, and I went to start traveling as respiratory therapists all over the globe. And that's when you get to see new innovations, new ways of things being done. And that's when we've seen that there's like beard covers as we're kind of transporting one of our patients. And as we've seen that, we're like, if there's beard covers, why isn't there hijab covers? And we're like, you know what, let's start Googling it. So we're trying to see something we can buy so we can wear it. So we didn't see anything that we can buy. We saw a couple of stories. But that's when we took on the initiative to finally bring about disposable hijabs. And it's been almost 2 years, and we finally launched in November. And so far, we've had about 4 hospitals taking our hijabs, and about over 10 hospitals sampling it right now. And it's been quite the journey, but we're very, very grateful for it. Yes.
Thank you, Yasmin. It's a familiar story, isn't it? The I need this. Where can I find it? Oh, I can't. I'd better make it. Yeah. Okay, my turn. My particular expertise is digital health, and I see digital health as a meta-innovation in its own right. I see it as a paradigm change that we're only really just beginning to enter now. The time of digital health is still ahead of us. And let me use the example of today's virtual hospitals. We've had programs like hospitals in the home before, but today's virtual hospital programs are really belong to the digital age. And I'll reference a program from Australia, which is called My Home Hospital. Typically what happens there is that an emergency department or a general practice might have a patient that requires acute care. Once a referral is made, My Home Hospital arranges for the patient to be transported immediately back to their home. And while that's happening, a registered nurse packs a large red box with medications, diagnostic, treatment and monitoring equipment, point of care tests, etc. Anything that looks as though it will be required for that patient, based not only on the referral but all of the information that's available through their electronic health record. A clinician then meets the patient at their home, usually at about the same time as the red box arrives via courier, and the clinician develops a plan for that patient and shows them how to use the mobile monitoring equipment to make sure that data gets fed back to the virtual care centre, etc. If there are visits required to other services, then the clinician also arranges those the patient transportation for that. And what are the results? What's actually happening as a result of that service? Well, so far, cost savings are equating to between 19 and 35% compared with the same service being delivered in a physical hospital. So it's cost effective. The service has been accredited under Australia's National Safety and Quality Health Service Standards. So safety and quality is being provided as well, and that's being tested. But really importantly, the most important thing for me is that customer satisfaction levels with My Home Hospital are approaching 100% now that the service is well established. There were some opening glitches like with everything, but now the service is getting much better satisfaction ratings than the same services in a physical setting, using the same data capture instruments. And just to round out the service, clinicians really like it too. So I know that virtual hospitals are arising all over the world, and in fact there's a good example of one right here in Dubai. But the important thing is that there's much more boundary pushing to be done. And I think that virtual hospitals provide a really good example of person-centred healthcare innovation using the digital technologies that are now available to us. So there's a series of healthcare innovations that have some things in common, I believe. Not just that they're using new technologies, but also that they are increasingly person-centred. And that person may be the clinician or they may be the patient, but it's about person-centred and digital enablement. Now, I have a question. Dominique, how can it be the things you talked about comprising health, you know, social, emotional, mental, etc., that is pretty much the 1948 WHO declaration of what constitutes health. And yet lifestyle medicine is new. How can that be? Where have we been for the last 60 years? What happened?
You know, this is really the key question. I wonder that myself many times because the concepts in themselves are not new. We have known much of it already. But as I think many of us know too, it is the transfer from theory to practice that has been missing. And it has been missing in all areas, particularly when you look at medical education. If we were to study medical education, we will see that lifestyle medicine is not part of the curriculum. It's not. This is why this industry has emerged quite unregulated over the last 2-3 decades. That means we have professionals within lifestyle medicine that are not part officially of the medical community because it has been unregulated and not part of the curriculum. And so I see that as a very interesting development, and so more and more, and maybe I can reference this. You may have heard of the Blue Zones study. It was a large international study, one of the largest there is, on lifestyle factors worldwide. And I believe that study, because it became so public through the media, actually launched this movement into becoming more organized. And so I'm very happy to see that, and that it's establishing its own discipline at this point, because I believe the time is now to realize the impact lifestyle has on health, healthcare costs, and like you said, on the person.
And you raised a great point, David, about the WHO definition, because what was not defined was what is healthy. So what we have done at Lifespin is we have taken 90,000 patient, actually samples from healthy individuals, 40,000 women, 45,000 women, 45,000 men from age 18 to 70 plus, which have been healthy. So we got these samples from a blood donation organization actually, and we have digitized all of these samples. We have quantified the metabolic changes over age. Now we have a baseline of healthy. I hope that we all are healthy, but we all may have a different age, different biological sex, whatsoever. But healthy is a range. It's a continuum of different conditions. Now, when you have captured this continuum of healthy conditions, then you can start looking at pathological deviations, and then you can start looking at metabolic changes which are indicative of specific diseases.
Any other comments on this? No? Okay, I do have another question, this time from something that you mentioned, Prashun, and that is AI. Now, of course, just in the last week or so, we've had the European Union release its paper on the regulation of AI, and in the last couple of months, we've had some statements from very high-profile people warning us about the terrible dangers of AI. Any comment on that development?
See, innovation is the in thing, of mainly medical industry, which I believe is we have to keep up with it. Anybody we have to keep up with it. If you see in terms of the prevention, cure, and promotion, what has happened is in terms of cure, if you see, first there were surgeries happening, open surgeries. Then we migrated from open surgeries to laparoscopic surgery. From laparoscopic surgery, we have migrated to robotics. And tomorrow we don't know what is going to come. Maybe non-invasive laser surgeries are going to come. So we need to keep up with it. We need to keep up the technology, like IOI and everything, to embrace what changes are coming in the industry.
Okay. I think it's interesting and very sensible that the EU guidelines are based on risk. The difficult question is always, of course, whose judgment of risk and how do you quantify it, etc. Because innovation requires taking some risks. So it's always the where is the drawing of that boundary that's important. Anyway, now over to you. We'll be changing the topic a little shortly, but questions, comments about what you've heard thus far, or contributions about your own innovations in healthcare that you'd like to share? Do we have a microphone? Yep.
Can I please have a microphone here for the audience? Thank you.
Good morning. Thank you for the interesting discussion. I've got a question for Dr. David. You're telling us about virtual hospitals. I'm just thinking about it because I have not encountered one. What in case if a patient gets sick under the care of virtual hospital? Can all the medical data that you have in your virtual hospitals be transferred to the physical hospitals? Or how do you manage this patient now in a real hospital setting? For example, I'm just giving an example. If I've got a myocardial infarction and I need an angiogram, I have to be sent to the hospital. Am I right? Or do you manage that in your virtual hospital? No, right?
No, there are some tests that increasingly can be undertaken at the point of care. Okay. But if a person does need to go to another setting, whether it's to a hospital or to a diagnostic testing facility that has more advanced capabilities, then patient transportation is arranged so that the person can go to and from. So it doesn't completely remove a person from the hospital system. And similarly, high acuity patients are not left out of the program. If someone needs a stay in hospital, then that's a part of the plan, but they are stepped down from that physical hospital to other settings as soon as possible. So I guess the basic philosophy is that physical hospitalisation becomes a last resort rather than a first resort.
Okay. So the AI data that you have on a patient, in case the patient needs an hospitalization, could be transferred rather than the patient going into the whole lot of things. Okay.
Yep. So you just... One of the things about it and why it's now, as I say, a part of a digital health paradigm, is that we do increasingly have interconnection between various services. Now, I spend a lot of my time working on interoperability and standards and passing information around. But it's increasingly happening that you can move information around the system and you know far better that what a patient might need. Predictive analytics are used too to see what a patient's pathway might look like so that you can try to manage things and keep them away from a hospital as much as possible.
Any other questions? Yes.
Good morning. My name is Dennis. I have a question regarding AI. So you're talking about management mainly, but I have a question also about, would you consider AI-assisted medical decisions? For example, we've seen there is a huge delay and sometimes bias in diagnosing women-related conditions, and this is a huge problem, especially I work in the UK, and in emergency department, this is also quite a big problem sometimes. Would AI be an assistance to diagnose other health conditions?
Over to the clinicians in the
AI is, in the healthcare domain, AI is in a very nascent stage, and developments are definitely happening in AI, targeted AI. Hopefully, in very recent, we will have a proper diagnosis through AI, with the pre-information of patients. And that's not a very far thing. That's going to be a very near thing. That's what my belief is.
Thank you. And last question. Are you aware if anyone is actually implementing this at the moment, or it's just a project?
This is basically in project. Now, as per AI practice in hospitals for understanding patient parameters is not happening. This is still in a R&D stage, and hopefully we will get a very good result very soon on how to utilize the AI data for patients' treatment.
Thank you.
Thank you.
Yes. Can we give the microphone to the table just behind you, please? Thank you.
Thanks, David. So good morning. Hi, I'm Dr. Kenny. I'm from Malaysia, Sarawak. Thanks to the panelists. Thanks, Dr. David, for your introduction and this topic. Just a question to Dr. David regarding community hospital and with other panelists. The question mainly is the concept of community hospital. I'll put it nearer. Okay, thank you very much. The concept of community hospital is actually a very progressive mindset because you want to scale and reduce the workload, especially in tertiary centers, especially with areas with large infrastructures, limited infrastructure and connectivities. So you wanted to scale as much possible to people or person as possible. So what happened in Malaysia, we actually have a similar platform called Doctor 2.0, Doctor to Home, that they use a similar concept using an online platform then allows the community to access towards healthcare request for allied healthcare to go to their houses to seek treatments, for example, nursing care. My question will be, actually, what is the prerequisite for Dr. David's hospital concept from a regulation perspective in order to allow the doctors to go towards the patient's house to deliver treatment to reduce the risk of negligence? Because what happened in Malaysia is the regulation are not allowing doctors to go out from a healthcare facility in terms of hierarchy assessment. So when we go out to a patient's care, community care, the issue we are facing is we do not have a benchmark to decide whether or not this patient are supposed to be treated at home, or should we go send them to a tertiary healthcare, and how should we monitor them if we are going to deliver treatment? For example, are we going to give a IV cannulation medication, drips settings, or can we actually deliver it in the local setting at home, which is possible in Australia? So that are the regulation prerequisite that we hope that maybe Dr. David, you can elaborate further. Then I can actually share with my colleagues in my hometown. Maybe we can actually move forward to actually reduce the burden of tertiary healthcare facility. Another part will be actually, mainly is that part. Regarding the benchmarking of triaging, what I recently went to, regarding the benchmarking of triaging, recently I actually went to Singapore, and what Singapore did is the Singapore National University of Singapore and also the Singapore General Hospital, they actually have a new AI system they developed for the past 3 years. They use a massive database system to actually recognize early symptoms. For example, by imaging, they actually can triage and knows that this patient is going to progress towards stage 3 or stage 4 severe lung disease. So using this massive data system, they actually progress further to actually use it for triaging and identifying patients that are actually going to supposed to be receiving a much higher needed healthcare, such as red zones, etc. So maybe from that perspective, I just want to contribute towards Dr. Davis' idea in terms of benchmark of triaging. We can actually build AI on top of it and create a system that allows a global database assessment, so that if we were to go globally in terms of technology and in terms of global community health, this kind of application can assist the healthcare provider to assess at the point of care, to know that this is the benchmark required, and with the database is required that we should actually send them to the hospital instead. That's all my question. Thank you very much.
Okay, just a couple of quick comments. Firstly, regulation is obviously an extremely important topic, and one of the issues that I think everybody on this panel has probably encountered at some stage or another is that regulation is a slow beast, and it does take a while to catch up. And in fact, we've seen in many other industries that digital innovations sometimes skip well ahead of regulation, like in the transport space, etc. Uber, are Uber drivers employees or contractors? Many countries are still working that out. In health, it's a little trickier because we are such a regulated industry, and need to be, because there are life and death issues involved. But I think the really important point you're making there is that you can't innovate without taking regulation strongly into account, and Ali will talk a little bit more about that in a moment. The second point, I think, is simply that, as I said earlier, the reason these new generation virtual hospitals are part of the digital paradigm is that they do have to be surrounded by a range of technology platforms and capabilities such as those advanced analytics, etc., that enable us to really take advantage of new care models. Now, we have to move on, I'm sorry, but let me just change the subject a little. Dominique, we've talked about some specific innovations here. Raising your telescope or looking into your crystal ball, what do you see a bit further out? What's coming that's really going to change health and well-being?
Yeah, maybe really tie into what I just said already. I do see in the very near future the, so to speak, slow marriage between lifestyle medicine and the traditional medical healthcare system. The certifications are now expanding quickly across the globe because they're now actually quality certifications in lifestyle medicine. So I see that becoming an integral part of healthcare delivery in all areas. So that's one thing that I see developing in this space. Another element is the entrepreneurship coupled with lifestyle medicine, because it is fast and impactful. It is reaching more people quickly. And so I see innovative entrepreneurship combined with lifestyle medicine, just as we've seen with the mobile trackers, etc. And there's more coming in that landscape quickly. And last but not least, I do also see one new factor being added to lifestyle medicine, and that is the environmental impact. The pollution that we see through the world that we live in, through the food production, through technology and everything, that is becoming such a big element within lifestyle and healthcare that I see that evolving and merging. So those are three areas I see within lifestyle.
One important aspect is, I think, standardization, especially when it comes to new technologies, but I think also about lifestyle. You can speak to different experts in different parts of the world, and you may get sometimes different answers. And I think one important aspect is to really ensure guidelines for standardization, because only when with standardization, then you can really actually compare impact of different things on health in general. Second item is, when it comes to the regulation, only when you have standardization, only then it can become accepted by the regulators, and only then you can really promote it in a, let's say, high impact fashion. Otherwise, if you, for example, read the FDA's, the US FDA's lifestyle wellness guideline, it's just a 9-pager, which tells me that there's not really much standardized, which is, I think, a huge opportunity to standardize it in a sound and solid fashion, that regulators will become more amenable to that, because only then you can really disclose high quality information in the medical context, and only then, now comes the important part, the payment, only then you can attract payers to really reimburse it, because from my perspective, the, let's say, regulators are not really such a huge challenge. If you basically deliver what you promise, what you should do no matter what, that's straightforward. I think it may take time, but it's straightforward. The more important question is how to convince payers, independently of the national payment systems. Important is to convince payers, insurance companies, corporate health programs that these tools are really useful. Only then will we get mass adoption.
Ali, can I ask you about clinical politics? Let's just call it that. So, for example, in Australia during the COVID epidemic, we had, or the pandemic, we had a number of telehealth operators that were new to the market. And our medical colleges lobbied to the government to have them closed down. And the reason they gave for that was they said they were providing poor quality care. Yet, interestingly, the people who were providing the care through those telehealth providers were in fact the same people who were doing the same thing in other general practices, etc. So the suspicion, the strong suspicion from me anyway, is that what was being closed down was a threatening business model, and safety and quality was being used as a front. Do you see any similar things in your experience in innovation in the medical world?
I mean, health systems or the healthcare value chain in general is dominated by incumbents. Now, the question is how to overcome the domination of the incumbents, not the incumbents. They are all fair and solid, right? The question is more how to overcome the domination of the incumbents in healthcare. This only happens, I think, if you show impact. That means if what you show is truly useful, because then there will be a pull on the market side. I'm always a big believer in the market. What does the market want, right? That's very important to understand that. And, you know, technology is sound and solid. It will happen at the end of the day. It's a bit painful in healthcare, right? It's not like getting a new PlayStation out and people will buy it because it's just available. It's a bit more tricky, and that's why I'm saying it's so important to work in a standardized fashion, to work in a comparable fashion, that then you can really convince people with data and not with politics.
Great answer. Prashun, we don't want to make it sound like innovation is easy because we know it's not. Maybe it is for one person in 1,000, but for the rest of us mere mortals, it's a hard slog. What can you tell us about how organisations can become ingrained and sustained innovators?
See, firstly, we have to understand innovation is not only technology or digital. It is a mindset. It's a culture. So every organization first should draw up their mindset to change. First, understanding that we need to change, we need to innovate is the most important thing. Secondly, what is very important is to understand what kind of new innovations is going on, happening in the world, in different other industries also, so that we can adapt them in our own organizations. Thirdly, that is very important, is to collaborate and have partners, because not that we are experts of everything. So we need experts in different domains to collaborate with us to walk into the path of innovation. Once we have done that, then we need to design innovations, understand what kind of innovations we need to do, and once that is done, we need to upgrade the skills and training of the people involved in the organization to innovate. And we don't have to forget, the most important thing lastly is keeping the innovations as per the regulatory norms, as per the security norms, as per the policies of the industry. So all this put together, like it's a culture. What I say, it's a culture which needs to be embraced by all the organizations to float above.
Thank you. And Yasmin, sorry to drop this question on you, which I hadn't told you about, but just comes out of what Prashun was saying. In your experience, very recent experience of innovation, what advice would you give to the innovators out here?
My advice to everybody is understand, keep...
Sorry, I was asking Yasmin.
Yeah.
Sorry.
The advice I would give is that to believe in yourself, number one, and have a purpose behind your innovation. When you have a purpose behind it, you're going to seek to find the solution in it. And to also know that to get help when needed, that you're not supposed to find all the answers by yourself. Me and my co-founder got our FDA approval by ourselves. And it took us a long time. Had we known there's consultants and there's help that could be given, it would have made the process a lot faster. So I would say have a purpose, be driven, and know that if there's a need in the environment or in the system and you have the solution for it, go for it. Yes.
Thank you. Sage advice. So we've got time for one question and here on the in the front.
Sorry, I thought the microphone was...
Thank you so much for your panel discussion. I've been listening to you and I've been thinking the whole time. Innovation starts from the very high point, right? So what about the patient? I mean, I'm just thinking, what advice will you give me right now when I get home tonight to get to my patient and tell them, this is what you should do and this is what you should not do? So I've been missing that in the panel discussion. Can you just help me with that, please?
Okay. Sorry. Could you just repeat the question?
Okay. I've been listening and I've been wondering, okay, I think innovation is very, very, very good. However, I've been missing just one probably crucial part, and that is when I get home tonight, how do I get to my patient and tell them about lifestyle medicine, for example? I've been missing that. So if you could explain more, please. Thank you.
Yep. Prachun, do you want to just make some comments? What practical things can the audience here take home tonight?
I'm not very clear about the question, but still I will try to answer what you are asking for. Is what would you like to take away from here from this session? Am I correct? At the end of the day. So the most important thing is innovation is very important for any organization to survive, for any human being to survive. Understand what is happening around you so that you can adapt those innovations within you. Maybe it is individual, maybe it is organization, so that you keep on innovating yourself and move ahead. That should be the main takeaway from today. Could I answer your question?
Okay.
Oh.
At time, sorry, yes.
Yes.
Last comment.
Sorry. So your takeaway for your patient is what you asked. So patient satisfaction is very important in the hospitals, and especially with the disposable hijabs that we've created. Listening to your patients, the need is within the patients as well. Especially with our patients that go into MRI, my co-partner had a family member that she assisted to go to MRI in the United States, and they gave her a bed sheet to wear on her head when she asked for a sterile hijab. So asking your patients what is the need, that is the gap in the system, that you can assist with them too. So we can be able to figure out what other gaps are in the system too. So, yes.
Okay. Thank you. I'm sorry we have to truncate the discussion now, but our time is up. Please thank our panel.
Please put your hands together for this incredible panel. Thank you, David, for moderating. It's very interesting to see how healthcare and the digital landscape are converting, even more so with lifestyle medicine. Thank you very much, panelists. All right. Our next keynote speaker is Mr. Donald Sweet, Chief Executive Officer of SNOMED International, and he will be speaking to us about the International Patient Summary and its impact on public health and population health management. So please put your hands together for Mr. Donald Sweet. Let's set the timer, please.
According to the display, it said I had no time left. So really today what I want to try to accomplish is first let you know about what's happening in interoperability, which is for all of us in healthcare probably the most important thing that we need to solve in order to help become health systems around the world that have patient-centric focus. I also want to talk to you a little bit about what we do and how we play in the interoperability space, but also address what was stated earlier up here around the need for data that moves seamlessly across systems and means the same thing in both systems, and also touch a little bit on also AI and also population health management. What does interoperability really mean? For me, it's pretty simple. I have a bank card, I can travel around the world and I can see how much money I have in my bank. I can move that money, and I can be updated regularly on what's happening with my money and my investments. In this day and age, there should be no reason that I, as a patient, don't have the same access to my health information and see what's happening as I go through the health system in various stages. It's really unacceptable, in my view, after being in healthcare for 40 some odd years, that my clinicians can't even follow the information that is gathering on me as I go through the various stages of the healthcare system to treat different diagnoses and different diseases. So really, it's something that has to be timely. It's something that has to optimize the health system to better outcomes, and really, it's all about the patient and the populations. There's a whole host of problems that need to be solved, and we heard a host of issues up here and some great things, great innovations around lifestyle, around AI and other pieces. But the population movement has changed over the decades. Pre-pandemic, we probably saw the world as a smaller place and a much more accessible place. COVID-19 hit, and all of a sudden we spent 2 years in lockdown and wondered what went wrong. The key is, how do we as individuals move around the globe but have our information follow us in case we need that information in order to receive care from a different health system. The other piece is unscheduled care. One of the things that always amazed me in healthcare is the fact that the health system never knew what was going to happen on any given day. They had to try and, as best they could, plan for the onslaught in the emergency rooms, plan for the long lines to get lab tests and diagnostic tests, and for those things that were unforeseen. Hard to believe that an industry survived this long with no intelligence about what was facing them on any given day. In order for healthcare and the treatment of patients to improve, you need the information. You need the data collected. You need to understand how healthcare is changing, and the only way you can do that is to share anonymized data globally. And right now that is happening, especially in the research areas where there are large groups of very dedicated individuals researching genomics, researching cures for diseases, and they're doing it because they have the data to allow them to collect a large enough population size in order to make some informed decisions and move things through both what they're doing for treatment cures, but also clinical trials. And also, as a government, how does a government plan if it doesn't have the data to direct the financial and human resources to areas where it's most needed, for mental health services, for those homeless, for those that are low income? All of these things are things that need to be addressed. Not long ago in the United Kingdom, the G7 finally stepped up and dedicated some resources towards interoperability. And really, from a perspective, this kick-started a host of discussions around interoperability and what it means for healthcare. From the G7 came the Global Digital Health Partnership, which has 26 countries. They work hand in hand in order to move forward with the very first use case for interoperability. And I would argue it's probably the most important use case that needs to be solved in order to start things moving forward, and that's the International Patient Summary Set. That set has all of the relevant patient information standardized, and the goal is to have that deployed in all countries around the globe with a set of standards, and then have that information move wherever the patient needs that information to be. And you'll see on the slide that there is a Joint Initiative Council, which is made up of a number of standards They meet on a monthly basis and they coordinate the work of those standards in order to start to move things forward more quickly in order to get the standards in place to do just what the International Patient Summary Set is supposed to do. There's 3 key standards in there. Clearly we have SEN from the European environment, we have the International Standards Organization, or ISO. HL7, and more particularly in this case FIRE, is really the message standard that dictates what the payload is supposed to look like as it starts to move from one care area to another. We have IHE, which is a standard for profiles, which gives more context and information around what's happening and what's coming across. And lastly, you have SNOMED CT, which is a clinical terminology which effectively codes the clinical information and other information in order to move that information and have it mean the same thing in both systems. So here is just a snapshot of what we have in the IPS that is relevant, and the IPS continues to grow on a regular basis. But if I was a patient, my medications would be there. Key is around allergies and intolerances, because if I get hit by a bus in a different city and I'm allergic to penicillin or another medication and they can't talk to me and they can't access my record, then they may give me something that I may be allergic to and it may cause an adverse event. We also have, what are my recent problems? What are my immunizations? What are some of the recent results that I had, whether that be lab, whether that be radiology or other testings that were done? And certainly, what are the relevant procedures that have happened lately? In my home province in Canada, I have a healthcare record that is probably thicker than most phone books. My doctor can't even begin to go through it and understand what's in there. And in some cases, he doesn't have the time to do it anyway because he's only got 10 minutes to see me, diagnose me, and provide me with some treatment. So this helps solve some of that problem. So this gives you a bit more context to what's in there. I won't go into it in any great detail, but what it shows you is there is a structure to it. Is it perfect? No. Will it grow? Yes, indeed. But it covers most of the relevant things, and it gives, I think, organizations something that they can start to build other use cases around for their own purposes and to deal with their own catchment populations. So we clearly, as I said before, deal with really a medication summary, allergies, intolerances, problem lists. We even have medical device information in there because it would be nice to know whether or not I'm wearing a pacemaker if I collapse here this morning, and what type of pacemaker it is. And as you can see, there are other things on the list as well. The key to all of this was the fact that one of the frustrations by governments was that things were moving too slowly. For a number of years, standards used to work in isolation, and they might talk to each other, but for the most part, they did their own thing in their own space. And really, the Joint Initiative Council was a first step, along with the work of the Global Digital Health Partnership, to start to get standards to talk to each other, those organizations, and start to work together, eliminate duplication, and actually allow healthcare providers the ability to actually standardize information, take a look at patterns within the information within their catchment population, and then start to look at, God forbid, preventive medicine and targeted programs towards the homeless, those who need mental health or other illnesses. From a SNOMED International perspective, we are part of a bigger ecosystem. We recognize that. From our perspective, the clinical terminology is really the hub, and through various means, whether it's mapping, whether it's including content within the terminology, whether it's agreements to have extensions of other vocabularies linked to SNOMED CT, it provides really a hub effect where end users have a much more simple process in order to start to codify the information. We heard this morning that AI is a big piece of the future. I would agree with that. But we have to be cautious. And I think we also have to have a clear foundation mandated for AI on which it's going to learn, not a fragmented approach. I can remember standing up here probably 10 years ago and having someone who was in the very beginnings looking at machine learning saying, well, you don't need standards because we can do it all through algorithms. But who monitors the algorithms? Who quality assures those? Is in this case for artificial intelligence, is it learning the right things? Is it the sources of truth? And more importantly for all of us as individuals, how do you certify that the AI is working correctly and not going to make some mistakes that may end up killing people? So what we try to do, and I'll give you some background on our organization, we're a not-for-profit. We do not sell anything. We're used in 40 some odd countries around the world. And those countries use the standard along with HL7 and other standards in order to codify their data. I was a resident of the UK for 3 wonderful years. And the joy of living in the UK for me as a patient was the fact that I had an electronic record that I could look at. If I went to a hospital for an eye operation and they discharged me, I would automatically see the discharge summary. It would be on my phone. My clinician at the practice would get a copy of that discharge summary, and I was surprised that they actually rang me up and said, if you need any help, we're here, and we understand you're on these medications, so we've added refills in case you need more. They follow me all the way through the process. If I went to another hospital in a different area of the United Kingdom, that would be part of my record as well. And I could see a summary view, which allowed me to then make informed choices about what I want to do with my health. Do I need an intervention? Do I need to go see a pharmacy consultant? It allowed me to become more engaged and more involved in what I wanted to do with my health. And all of that was enabled by a set of standards with some very good technologies, one would argue, some not so good, that allowed me to see that. And hearing the panel this morning ahead of me, clearly one of the things that struck me was the themes were we need to see the information. The information needs to be the same and understandable in the way I practice medicine. We recognize that AI is both something that may be very, very good or something that may have a very detrimental effect. But underlying it all was the fact that you need good data that moves without regulatory blockages in order for people to provide care to patients, whether that be in the lifestyle area, the mental health area, or any other areas of healthcare. For us, it's been an evolution. So we have what we call an international release. The international release is freely available in a flat file format and also a global set format. We then started working with HL7 on the IPS free set, so it's freely available to anyone to look at and to use worldwide, and that includes the HL7 FHIR messages as well and other applicable standards. We then moved it to more of a reference set to add more things into it and also make it constrained so it wouldn't overwhelm certain systems. And finally, we've released it as a free hierarchical set of codes that spans what is required for relevant patient information as it moves across and around the globe. From a terminology perspective, one would say, well, and I look at the the lady who asked the question about the clinical care in myocardial infarction, she calls it myocardial infarction. Somebody else may call it a heart attack. The hierarchical nature of SNOMED CT is you can add synonyms. So in your case, when you see something come across in your system, it will call it myocardial infarction. If it comes across in another clinician's system, it may be what they call it, which would be a heart attack. It's very flexible, it's very easy to use, and certainly it allows the ability to eliminate a lot of third-party solutions that would suggest that if two standards are in the same area, you need a proprietary map in order to link both of those together. That's not required. You can add the other standard as a synonym, and you may hypothetically get the SNOMED CT code as well as perhaps an ICD code or perhaps a LOIC code, a DICOM code. It just depends on what you want to use it for. So it's eminently easy to use and reasonable. I know we're going to hear later about complexities in healthcare systems. I'm going to be interested in learning about that one because I think every health system is complex, but the key is you have to have a foundational base in order to move the information around and have the systems have the capability to move it correctly and efficiently. I'm going to stop there. I've got about 13 minutes left. I leave you with this. This is the thing that we believe in. No decision about me without me, and that's where we want to get to. In this day and age, we should take ownership of our health. We should be given that ability, and we should be armed with the knowledge and information to make informed decisions about who treats us, what are they treating us for, and what the outcomes will be. So I will leave you with that and open it up for any questions. Thank you. I'm sure there'll be lots.
Thanks, Don. And look, I really applaud this piece of work. It's certainly something that many of us have been advocating for a couple of decades now. And I know how hard it is to develop international standards. I've been in many of those groups myself. My question is, yes, it's hard to develop international standards. It's often even harder to get them implemented. Has there been discussion with vendors associations around the world? You know, it's okay for governments to say, yes, we want to implement that, but you still have to get industry alongside. They're the ones who actually embody it in their product.
Well, as always, healthcare is a business. The interesting thing about vendors, and I spent part of my career working with vendors, is in the early days, they saw standards as something that was really an enemy of theirs because it robbed them of their implementation revenues. However, we've turned that around and suggested to them that effectively, if you give people what they want, and you may be one of only the few that are using it, then maybe you will make even more money and save yourself some headaches on the back end. From a organizational perspective, we have an vendor engagement part of it. We meet with vendors. We have a number of vendors such as Epic, Oracle, Cerner, and a host of other vendors that use SNOMED CT within their systems. The question for us is, and what we're trying to grapple with, are they using it correctly? And what we want to do is educate, and we've done that over the past 3 years of having programs where we would educate vendors on how to properly use SNOMED CT within their systems. Your point about implementation, we have an implementation team within our organization, and anyone can ring us up if they have an issue or they have a question about how to deploy the terminology or the IPS within their systems, and we'll help work them through that in order to get them to a point where they actually can do it themselves. We do offer free educational courses. And it's a range. So you can start with the beginner course of SNOMED CT. There's developer courses. There's The one that I don't think I'll ever do, which is how do you author a terminology, because I think I would probably break down and have a little cry. But we do offer that. So from our perspective, we also work with the other standards organizations to put on joint education programs in order to make sure that people are aware that it's not just one standard, it's a group of standards that work together. But probably I would say the biggest roadblock these days is trying to educate the vendors because their systems are built on lines of code, and how adaptable can they be. On the international patient summary set, there is an implementation guide specifically developed for that. It's on the Joint Initiative Council site and on the standard sites as well. And that gives an overview of not only how to implement the international patient set, but how you pick the standards that you want to put into the summary set and how those are implemented as well. So hopefully that answers your question. Yes.
Thank you for your lovely presentation. I've got a question for you. I've worked with Cerner. Does Snowman City covers abbreviations? Because many times, working in healthcare setting, many people use abbreviations differently, and in many countries, abbreviations are used very differently. I'll give a simple example, the word right. Some people just write it R in abbreviation, some people say it's RT, and so on and so forth. So does Snowman City covers that? And if not, what is the future for it? Because it's really difficult for nurses like me reading notes sometimes.
So one of the things that we've seen, and it depends on how you implement Snowman CT. So I'll give you a classic example, Hospital Italiano in Argentina. They have a bigger set of Snowman CT than we could ever dream of. And for them, it was about putting in abbreviations and other things as synonyms. And let's take a broken leg. They had, I think, 25 different things that you could use in order to effectively describe a broken leg. And the beauty for the clinicians is they could just type in an abbreviation for right. They had already had that set up as a synonym, and it would automatically come up as right broken leg, hypothetically. So you can do anything you want with synonyms, and each doctor can have different synonyms as it applies to their practice. It doesn't really matter because it's all tied to the same code and the same structured text of what that code looks like. Again, probably the biggest thing that we need to work on, and we are working on, is making sure that the clinicians effectively should be able to, with the software intelligence, tick a box and the code's automatically applied. And we've seen some systems that do that very well, and other systems that sadly have to use drop-down boxes. So we are working with the industry to get them to a point where you can just tick a box and it will say, I present it with chest pain, and tick another box to suggest that I also present it with cold sweats or whatever the other symptom is. And that's really where we want to get to. So hopefully that answers your question.
Sorry, hi, Andy Norris. I was from the UK. I now work in Saudi Arabia, but I mean, it was quite heartening to hear somebody having a good experience of IT in the UK, because it got a lot of criticism. I mean, I have a lot of points about SNOMED, and I know SNOMED's been around for a very long time. And if I was being, kind of a little bit confrontational, I would say, well, you've been doing it for 30 years. Why hasn't it worked yet? And I kind of in that vein, I wonder whether, despite your well-founded concerns about AI, whether actually machine learning or AI or large language models, maybe that might be what this project needs. I think, we've heard a lot about, abbreviations, different things. I think, I feel it needs to be disrupted in some way. The other concern that I have is I think there's an element of perfection being the enemy of good here. I mean, as a clinician, you know, in the first half an hour of patient contact, there's not, you know, most of what I need is not very much.
Yep.
And perhaps, you know, trying to get this all integrated across platforms and across countries, maybe that's not really the right approach. You know, where do you see, what would be an acceptable endpoint of this project?
Well, I think, so a couple of things. I'm concerned about AI, but we're really embracing it as an organization. It just has to be done correctly. So I urge caution in that area. In fact, we're looking at how it can allow us to be more productive and more responsive to the people that we serve. It's a good question about what should the scope be of the international patient set. And it's been interesting to watch the 26 countries as they deliberate on that. And you're absolutely right. For probably 98% of what you do as a clinician, you would need the patient summary for me as a patient. And if I present with something new, then you would code it in your system, but it may be a one-time event for me and also for you as my family practitioner. The goal is to use the International Patient Summary as a starting point, something that would allow all countries to have interoperability. There will be a whole host of other use cases, but that's a different process and a different project that countries will deal with. But the key is to get the minimum data set in there to allow countries to actually move patient information around in order to make sure that that information follows the patient wherever they travel. I'm not a big fan of saying, I need my 100-page medical record being fully coded and being able to move. For me, it's the relevant information that's the key.
Thank you for the very nice, informative lecture what you have given. I have a couple of things. I'm a pure clinician, actually. I'm a consultant pediatrician, nephrologist. The issue is that actually to be able to have an international patient's record, we have first of all to encourage the local system first, to have a local system for each country that where each patient is having a universal record, where in each place where he goes, he's having his information distributed here and there after his approval, of course. The other things, don't you think that not all patients need to be, in this system, particularly in this system, patients who are healthy and just come for a couple of things, only small things, why should we take a part of the cloud and engage them in the international system while they can be treated locally in where they are? Other patients who are really seriously sick and they need the advice and they travel frequently, these are the patients who are in need to have their system and their records distributed all over the world to be able to help them and to find a solution for them. The other point which always annoying me, all these systems, unfortunately, they are so complicated that they are time consuming. And you know that most of the health services, in all the countries now, they are depending on the private. And in the private field, how many patients you see, it is your value. So you have to see much more patients in order to have, to have good records in the hospital. So the system has to be easy, practical, visible, and even if it is all the system will be with dictation, while I'm examining the patients, all the information will go to the system to be recorded without me spending another 15 to 20 minutes to be able to record the things to the patients.
I completely agree with you. I think, the final thing is we as human beings tend to over-engineer everything, especially in healthcare. And I think the goal for us is to get to that sweet spot where it's a help for healthcare providers to have data readily available. It's a help for governments to have the data readily available so that they can target funding to the appropriate areas. And we'll see what the future holds. But thank you very much again.
Thank you, Donald Sweet, right, of SNOMED International. All right, let us move on to our next panel. If we can have 2 more chairs up here, please, and 2 more microphones. So this is a discussion on pluralistic health systems, challenges and advantages. So the moderator for this discussion is Dr. Marcel Wainwright, Senior Surgeon at Integra Clinic, Luxembourg. Welcome, Doctor. And our panelists, Nandavigesh Ram, Chief Marketing Officer for Medawatar. Welcome, Mr. Ram. And Andre Raffenson, CEO of Oncotech Nordic. Welcome. Ah, there he is.
Hello.
All right.
Hello.
Will you use the handheld mic or the head mic?
We have mics here?
Because I see you have both, sir.
Hello? Yeah.
Up to you.
Are we on? Okay. Thank you. Here we go.
A very good morning, ladies and gentlemen. I would love to explain a little bit my background. I'm an oral surgeon based in Luxembourg, and my goal was always to focus or to intertwine the general health and the oral cavity. So pluralism means that we should be very open for various aspects in medical treatments. And we know that we use a lot of different materials in oral surgery and in dental medicine that might have an effect on long term to the patient. Some are very beneficial, others won't. So for that reason, I was always focusing a little bit on the impact of materials to the general health and the impact of disbalance in the oral cavity of our patients. We do have various data that show a lot of health issues that have their origin in the oral cavity. We're talking about diabetes, we're talking about health issues like heart problems, stroke, preterm delivery in pregnant women. We're talking about blood pressure. We're talking about chronic diseases. We have a lot of scientific data on that. So our goal is to focus a little bit more on the prevention than on the treatment of our patients. In addition to that, we use materials like composite resin materials on a daily basis. Since decades, we use titanium implants on a daily basis, but nevertheless, we see more and more people showing reactions in terms of allergic reactions or at least hypersensitivity reactions towards those materials. And on the WHO conference in 2021, it was decided that in the future, in the next 8 to 10 years, in Europe, European countries should address more the oral health, and every European country should develop a program that should enhance the oral health on the long term of our patients. It is nothing new that we know that if we have caries or if we have a periodontal problem, that this can arise on long term a very heavy, severe health issue to the patient. But we need to focus a little bit more on that in a preventive way. We should not only treat our patients, we should prevent those issues. So pluralism pluralistic health means to me as well that we consider new treatment concepts that are dealing with these things.
Yeah, when you start talking about the new concepts of dealing with the healthcare systems over there. So back in India, when we started MedAvatar, I'm myself Nanda, I'm Chief Marketing Officer of MedAvatar. So when we started working on this, we wanted to understand what exactly is the problem that we are trying to handle there. Because converting the PHR, EHR, and EMR reports into digital records and sharing that to the patients is a very difficult task. In a country like India, we are talking about a population of 140 billion. So when we start discussing about these informations, we wanted to do our testing through some kind of NGOs. So these NGOs are helping elderly people and also the people who are coming from the rural areas. So we are expecting a population of total 20 to 30% in overall India. And we started from the southern part of India, so how exactly it's been manipulated with all the informations. Then we got to know, as Donald was discussing about the SNOW, which is connected to multiple standards, we have a lot of fragmented data. If you go and check with any of the hospitals, say if a hospital A and B, C is there, each and every hospital having multiple entries of the same patients in their records. So we were not able to solve that issue itself, because if, say for example, a patient is gone at the age of 30, he's having one kind of records, and the same patient, if he is not able to go to the same hospital as because it is growing very high in cost, he is going through the NGO, and NGO is creating a new record for him. So we wanted to solve all these problems. So we thought we would bring an aspect of creating a blockchain identity using their Aadhaar, which is a kind of a social security number in US. So that will be able to connect and create an alphanumeric identity for them. So it's a patented technology, we created that. So once after you create a blockchain entity and you try to connect the interoperability between the hospitals were not ready to accept because they were running on multiple standards, especially like hospital in Apollo. We had a rough calculation of 20 specialty hospitals under the testing. So they have completely taken care of another hospital because they're acting like an enterprises. If the other hospital want to connect with the different hospitals, say the one hospital is running with ICD-10 and another hospital healthcare system is completely running with HL7, the integration is very complex for them. They're not able to do it only. So they are running the old software which they already have it there. So when we entered into that kind of a market, we gave the software for free for the healthcare systems so that we were able to connect with the labs and diagnosis centers, blood banks, and also with the other hospitals and small clinics, where the patient will be holding a card. That card will be having a private key, and the device which will be there in the healthcare, in the hospital, will have a public key. So that even when you go and tap it, you already have the Aadhaar information there, and the data will be pulled out here. So once you tap it, you'll be able to connect with any kind of hospitals wherever you go within India. And now we are already connected with 17 hospitals, which is there in Bangalore and other regions of southern parts. So slowly we are taking forward it. But still, when you talk about, again, we are coming to the standards, there are multiple N number of standards are there. It's not that easy to connect with all the healthcare system because of that standards only. So when we try to solve that issue itself, we are giving the software for free with multiple standards which we already given, 6 or 7 standards that we already have it, including FICRA and HL7 and all. So once you give all these informations to the hospital healthcare system, they'll be converted to our environment. Once the environment is completely migrated, there is a separate migration process also happening, but that's a tedious task. So when you talk about the pluralistic aspect, we have a lot of disadvantages. Just because of the fragmented data itself, you don't believe we had a data of 40 TB, which is very difficult to put it in the cloud. Because I was working as a cloud architect, I know if for transferring a 10 TB of data into AWS or a Microsoft, it will take at least 2 weeks of time. When you talk about a data of trillions of informations are there with multiple healthcare systems, it will be taking around 2 years of total migration work, which is very difficult because in that 2 years, again, a same person will be having a different sets of records in a different standards. So this is the biggest problem that we are trying to solve it. And hopefully, yes, there is a new technology which Mr. Andre is following that. We are trying to work with him to see what exactly is going to happen. Andre?
Thank you. Andre Raffensen, I'm CEO of Oncotech Nordic. We are a UK, Swedish-based company and have developed an app where you basically, by your own mobile phones, can scan your iris, and we're able to see all 4 stages of cancer, 4 different cancer types. Diagnosis is given within 45 seconds. We also see diabetes types 2, very easy, by the way, even pre-diabetic conditions. So it's a groundbreaking, cheap solution to diagnose patients. Everybody knows here that the best outcomes of cancer treatments, that's dependent on the early diagnosis. And with this app, you can catch the patients very early. We are rolling out now in 40 hospitals in Central and Eastern Africa, working with some NGOs. The product got CE marking last year. We're also rolling out in Hungary and Romania, basically taking country by country. We're focusing primarily on the medical sector, GPs, clinics, health clinics, medium-sized hospitals that have a patient flow where most of the patients really come once a year to get a health check, and by integrating the app in a general health check, occasionally we do catch diabetes and cancerous conditions for patients that didn't even know they had cancer, stage 1 or 2. Very often these patients are caught very late, and we know this from the cancer world, oncology. So if we can integrate this holistic into general healthcare, then we might be able to improve outcomes of oncological and cancer treatment.
Yeah, and here it goes again, back to the prevention. As Andrea was saying, the earlier, the better the diagnosis is, the better is the treatment options. And it is very, very uncommon that dentists or surgeons are checking out on a regular basis the intraoral cavity for cancer. Some cancers, the dentist is the very first one who can detect it. So here again, my mission is to spread out the information that a very thorough examination of the patient is crucial. And as we said, or as I said in the very beginning, that some materials have an impact on our patients, and the bacteriological status and the microbiome has an impact on the patient. I was writing a paper a couple of years ago that rheumatism, for instance, has exactly the same cytokine pathway like the periodontitis. And we do not know yet which was earlier there, the egg or the hen. So once again, focus should be a little bit more on the prevention and probably the implication of new biomaterials and materials in dentistry. So we switched a little bit from using titanium to zirconia to ceramics in implantology. We're using today plasma concentrates to enhance wound healing process when we do the surgeries. The future dental implants for sure won't be made out of any material. University of New York City has now launched a patent for a biomaterial scaffold that is injected with stem cells and with growth factors. So in the future, we just use these things just to let a new tooth regrow. Pluralism means to think out of the box, and I really adore those technologies that are soon available for various people, various human beings. So thank you for the information and for the impact of your magnificent development.
So still, as you said, with this stem cells and other things which are coming into the picture, there is a foundation back in India which we are working with them. So they collect the DNA information of the people and they create a categorization for that. So they are into something called like, they want to identify DNA-based diseases for the people who are there in a country like Africa and in India, so that we can create a complete inventory with that. And we already have an option of interoperability and AI at the back end. See, if you have something called as data for 1 year, you can do the trend analysis. Trend analysis, something like we can able to understand what kind of pattern that the disease is created for what kind of DNA categorization is there. Once you have the data of the same patient for another 3 to 4 years continuously, we will be able to do the complete predictive analysis. So that if the DNA categorization is been done, and say for example, if a patient tomorrow is coming to enter into the healthcare ecosystem, and we already have this information about the DNA, is biometric, and all the allergic system which he has, allergic, diseases which he has had previously. So we will be able to predict something for him like after the age of 30 and 40, what kind of diseases might affect you, and when you talk about the preventions, which can also be taken care on a priority basis for each and every people before itself it causes. So we can make the pluralistic aspects into a different level of sector to make the people to understand what kind of things that they need to focus on. So this is how we plan. Like, there are multiple foundations which has come into the picture nowadays. As this one of the foundation who is working on this DNA and all, the other foundation is working on the energy sectors where they calculate only the calories of nutrition foods that which you need to work on, so that the malnutritions can be rectified and all those things. I think it's going to play a vital role in the future. We are waiting for that to see how exactly the AI is going to do all these things in the back end. Andre, you can.
Yeah, it's just to follow up what Marshall said. I think the issue we have, is that me? I guess that's me. I apologize. Sorry about that. The issue we have in Scandinavia is that even if you have technology available and you in terms of diagnosis or patient screening, find an issue, in order to get a biopsy, etc., you can sit and wait for 2 or 3 months. So just to get a confirmation, you can go from stage 1 to stage 3 cancer before you even get to the biopsy. So getting the technology integrated in a holistic system where you push the environment to get treatment much quicker, I think that will help. I think it's a key in general in the medical world. Once you go into private, it's different. But in public health, that's a huge issue. Is the waiting lists, old systems, blood tests, mistakes. So even though everybody talks about AI becoming a threat in some points, but in terms of healthcare, I think that's a huge benefit.
So I would like to ask you something like
it's fast-tracked.
Yeah.
Yeah.
So you are already working into the system where exactly the retina has been scanned and the information about the people can be identified through that. So what kind of complex issue that you have faced it when you're trying to do all these things for multiple
people? Our issue is regulatory process. So in terms of FDA and CE marking, the technology moves so fast that the regulatory environment is behind it. So when we submit data, they have to consider going from traditional medicine, medical devices, units, all of a sudden, EMEA authorities have to look at software in terms of healthcare. And that has rocked the boat. I mean, FDA, basically Google, 3-4 years ago, they had a huge department pushing for Google Health. And these software developers, they came with brilliant products. They got like a whole line of them. They submitted it to FDA, and FDA just pushed back. They said, that's not our department, but you need to get it registered. So what do? So now eventually they're catching up, and they are approving more and more AI-driven products, but we have the same issue in Europe, I think most countries, that the regulatory environment is really the bottleneck. So if we can AI the regulatory environment, that would be wonderful.
No, when we try to analyze some kind of place where, like in Australia, so they have all this information which is connected only with the government. So when they are discussing about having a complete data of images, the images volume was like too big for us, at least just in one small place, like it's a small town. I don't remember the place of the name of the place. So when we try to accumulate only the images, because when you do the MRI scans, there are other images which will be populated through that, and the videos which you are taking it through the other operating procedures which you are doing it and all. So this image data and video data was consuming more than 20 to 30 TB in one small city for the crowd of, I'm talking about like 50 or 50 to 100 and 200 people. So which was very big for us. If you go for cloud to do it, right now, the cloud, I would say that even the AWS or Azure or other things which is currently there in the market, right, they won't understand. AI is not in the full-fledged manner in the backend data. Because this container, once you start spinning a container, it will be running it for hours continuously. Say, this is for kind of an example, when somebody is trying to open your website, the website is open only once. So we can spin a container whenever it is required. So we thought like we will not be able to do much on the backend data side. Instead, we will be able to convert those images and videos into NFTs, non-fungible tokens. In blockchain, we call it as. So we convert those things as an NFT and have the people identity into blockchain. So everything has been interconnected, and it can be solved with a peer-to-peer connection where you don't have to worry about a lot of data management. So that's how it has all been. We are trying to solve these issues here. So once you talk about all these informations, how it can be done in the futurist aspects, it's in the hands of like people who do Andrew, like he's scanning this retinas and all, because you can do the biometric for a normal person, but it's not the same with a disability person. I have seen a person who is having complete disability, he doesn't have anything in his hands, like there will be no lines or any kind of imprints is there in his hands. And there are other people who are not able to speak in a right manner because their jaws will be in a different, like they're completely disabled. And only thing what you can do is like you can scan their DNA, or otherwise, as I said, with a retina. Only these are the two things which is available with them. And for the blind persons, it's very difficult for them to access the healthcare in most of the times. So they need a separate assistant itself. So we need to focus on what are the gaps that we still have. We are still trying to identify that. And we are working with multiple foundations to identify all those things. Once we have an answer for it, yes, I think we'll be able to crack it down. But it's a long way, heavyweight process that we have to wait and understand how exactly it's going to happen. Yeah. I think you want to share something about you were discussing. Yeah, for you, yeah.
Well, as I heard AI, in the medical field, we use it already, especially in diagnosis, even in dentistry. So since a couple of years now, we have those X-rays that are capable of doing an AI diagnosis. So as you said, AI is not only a threat, there is a lot of opportunities. And as well as the speed of transport of information is crucial, and the speed of managing our patients is crucial, especially in terms of cancer treatment. Yes, in 3 or 4 months, stage 1 can turn into stage 2. So we need to adapt here to the needs and to the increasing numbers of patients that do suffer, and just to be able to address these problems on time and with a specific information tool that can deliver on a very fast base the information to the doctors. So yes, I do agree with you, both of you, that this is very important in the future, and it's not that everything has only a dark side. Of course, there is pros and cons, as we know, but for the benefit of the patient, I see a lot of opportunities.
So you might have came across a lot of medical devices, right? So how do you see the evolution of the medical devices?
Well, on one hand, I see, as I made a little introduction regarding the materials, I see that there will be a shift going back a little bit from metal restorations in the oral cavity to non-metal restorations in the oral cavity. I started to place my first ceramic implants now 16 years ago. I purely place now ceramic implants. because all the metal behavior of a metal implant and metal restoration is missing, which is good for the patient. So we have no galvanism, we have no corrosion, we have no allergies towards any metals that are in the compound of the material.
Okay.
So that's number one. Number two, I do see the need of connecting doctors from different fields more and more together. When I read this beautiful topic, pluralistic health system, I would love more that any doctor from any different field should get the proper information and exchange knowledge on conferences, for instance, like these, just to see that there is more than the subject that we are dealing every day. So the internal doctors should go to the ophthalmology congress, the ophthalmologists should go to the dentist conferences and so on. The orthopedics should exchange knowledge with cancer treatments. So we should a little bit get out of the box where we are only a little bit like blindfolded in our own subject. I turned actually in the last 10 years a little bit more from focusing more on dentistry to the global treatment of our patients. So we give infusions to our patients. We check their status. We check their vitamin D status, for instance, prior to any surgery, which is crucial for us to achieve proper results. So it's not only like one piece that is like put together. We should see in a holistic way our patients, and here I see a very big need to improve things.
It's huge. The thing is that we have now, we launched the product as a test in an Indian clinic, and the Indian clinic is divided into, there's a holistic doctors and there's a traditional medical doctors, and both operate under different licenses, but it's one clinic. And we have caught some stage 1 cancer patients. First of all, they didn't know they were sick. They thought they were perfectly healthy. They came in just once a year to get the health check and the blood test. And we scanned the eyes, so we saw, and we got the biopsy to confirm it. Yes, you have stage 1. And usually, if you're in the beginning of stage 1, for most patients at age group young till 55, 60, you could actually reverse it by lifestyle changes. But if you sit with a pure oncologist, they're not dietitians, they're not lifestyle doctors, they're oncologists. So they have a tendency to send you to your traditional medical treatments, right? But where you really, in the Indian clinic, they push them to the holistic doctors, and they will make the lifestyle changes, and you actually can reverse it within 3 to 6 months. Diet, exercise, vitamins, and it's really simple, but it's not simple if you don't know what you're talking about. So I totally agree, it's a huge issue. Right now we have silos. Each specialty is in a silo, and they direct them in the silo, the patients, instead of sending them places where things can be solved fairly quickly.
That's right. So I think whenever you're sharing the data with the other doctors, so how do they come up with a result? Like this data has been, say for example, as Marshall is there in Luxembourg, if he is giving the complete discussion which has been happened with the patient, and you're doing some kind of medical treatment to him, when you send the patient to US or to a country like India, is there any question from the doctors they will ask you to do any corrections or what kind of treatment that you are given, or it's like they will not contact you for anything else? How does it happen?
Actually, it's a little bit depending on the doctor. It's not common that we get or exchange all the information, which I would normally prefer. Some patients are really good prepared, others don't. So here I see, a lot of things to improve as well.
Yeah.
Exchanging of knowledge, exchanging of data, exchanging of information on the patient from all varieties of medical fields should be crucial and should be highlighted a little bit more. And we should not forget that, I'm a teacher, I'm a professor at the university in Spain, but still I consider myself being a student, a lifetime student, now since almost 54 years. But we should always keep an eye on new developments and new things that we always can learn. It took me probably in the last 5 to 6 years, a lot of time to go deeper and deeper and deeper in those chronic infected bone areas that what we call like FDOJ, fatty degenerating osteolytic joint bone, that has sometimes an impact to the whole body in terms of migraine, in terms of problems with the joints. Some patients have shoulder, elbow problems. Others have leaky gut syndromes. And once we treated it with our concept, we cleaned those regions out, or sometimes it's just like only necessary to take out the metals of the patient. We can improve the general health of our patients dramatically. So here, once again, we should be more general doctors and not only focusing on the subject that we've been trained and focused for.
I think this is the first time in my life I've heard odontologists mentioning leaking gut. That's groundbreaking. We need more of you.
So I think to conclude from my end, I would say that we should be able to create a kind of a community where all the networks of doctors from around the world when come into one single place, where at least they will be able to understand what is a doctor from other countries able to do, or where exactly he is put on. So whenever you're trying to communicate with other, that the patient has been, the transfer of the patient would be way more easier. I think that can help a pluralistic ecosystem to come into a better place on healthcare. That's it from my end.
Yeah, same. Uh-oh, we're in trouble now.
Yeah.
Hi, I'm Shafi. Question to Ram. See, everybody, we carry a passport to travel to one country to another country.
Right.
Can the health data can be stored in the passport in the form of chip or in the form of code, so that any unforeseen situations arises, then the doctors can, directly go through the health data and they can treat him better? Is it possible for that?
It is possible, because right now we are coming up with a NFC technology. Like I have a ring in my hand, it's an NFC platinum ring. So the ring can be utilized as an NFC technology along with the cards, which is a very low cost budget for the people back in India. So once they tap it right, it becomes a health passport for them. So if you have the health passport in your hand, wherever our ecosystem is getting connected, now if it is possible to connect with the other countries as well, there is a QR code also, easily you can bring up with the technologies. If you scan it, immediately you can get to know the basic metadata information of a particular individual. Say for example, even if you go to any country, right, you will be able to scan the QR code. Correct. So through our website, if you scan the QR code and click on yes, right, you will get the name of the person, emergency contact, his age, his date of birth, and what he is allergic to. Say for example, if a person is met with an accident and you don't know about this person, when he is already a diabetic patient, if you're trying to treat him without knowing the information, that is a very disastrous thing that you're doing to him. So if you have the allergic information, what he is, and if it is a diabetic person, you get to know about this thing. It'll be very easy. So right now we have that in place.
And it should be done for all the countries, I suppose.
Yeah, it has to be explored.
Yeah, Andre, this question is for you. So you mentioned about developing a technology in the Western country and moving it to Africa. So can you speak about if you faced any challenges in doing so, and if so, how did you go about overcoming those challenges?
Specifically in Africa?
Yeah, and specifically about your iris-based cancer screening.
Yeah, the product, it has a 95% hit rate, so it's pretty high. We're still nervous about the false positive. We had one. But no, Africa is, we actually chose Africa because we wanted to test the product in the most difficult market. And of course, it varies from country to country. We do have issues, like deer in Democratic Republic of Congo, they call us and say, we have no internet for 5 days, right? Or no electricity for 3 days. So there's more like infrastructure, logistical issues. But besides that, yes, there's one huge issue. The product itself is easy, it can be integrated in the whole hospital system, which, by the way, the modern hospitals in Africa are way more modern than they're in Sweden. They leaped from like Stone Age to the most modern. The issue is that if this, and it will become widely available, you might have patients diagnosed very early, but they have no access to treatment. And that creates a whole different problem. So in the beginning, when we developed the product, we thought opportunistic, this should be available to everybody in the world, right? And everybody who is 45 plus age should be able to have it on the phone, just scan themselves. The problem is, there's, first of all, liability issues like in US. US is, you will be sued out of your apartment, right? So we decided to target the medical community in a controlled environment, and only the countries and the general practitioners that have access to oncological treatment. Because a woman with 4 children gets diagnosed with stage 3 breast cancer and has no access to treatment, it creates a whole different psychological, traumatic problem. So yes, there is an issue. It's a positive product, but it can also create a lot of damage if it's not controlled in a proper environment. And if there's no access to treatment, which is tragic. You can say the patient will die anyway, yeah, but going through that process, I mean, people will commit suicide, right? So we do have issues to consider, and we're moving very slow. We're taking it easy. We're not in a hurry. And as we get validated data and we can handle it, the traffic, stability, consistency, then we'll go to the next step and make partnerships regionally where under medical controlled environment. So yeah, there are issues. It's primarily infrastructure, access to healthcare, and sometimes internet just disappears for 3 days.
Yeah, as a follow-up to that, can you speak to any regulatory challenges that you faced as you were moving from one place?
That's why we avoided FDA. We're waiting. Once we're mature, we'll need a partner in the US that will deal with the headache. Like Google. Google basically closed the department. They had 46 people doing this, and they just gave up. They closed. Now they're reopening because FDA is catching up. So we just avoided US, and it's very expensive. So in Europe, actually, it went, I wouldn't say easy, but it wasn't a huge issue as long as we took step by step. So we didn't get a class 2A, like a full diagnostic. We got a class 1, and then that means we can screen as a risk for cancer, and that has to be confirmed by biopsy. And once we have enough data, which we'll have in 3 to 6 months from now, we will submit the documentation, and then we'll get upgrade classification. So as long as you ISO standards and you follow general procedures, it's not a huge issue in Europe, and it's relatively inexpensive compared to FDA. That's a monster to deal with. And like we're launching in Dubai at the end of this year, and 2 clinics, and they deal with the authorities, and we supply documentation we have from Europe, and it's considered, it's approved. So it's just work and time. It's not a huge issue. They're catching up because it's moving so fast. They have to catch up. They either have to revamp the whole regulatory environment, or they have to catch up. So I think it's easier just to catch up. And that's all for all regions.
Hi, my name is Dr. Rami Khalil. I'm an internist. This is a question for Dr. Ram. Mr. Ram.
Ram, yeah.
So I'm very fascinated, interested in the application of blockchain technology in healthcare. And I think it brings up topics of data ownership. Who should own patient data? Should it be the patient? Should it be a hospital system, a hospital organization?
So,
my specific question is, how can you reconcile the frequent need to augment or change one's health record with the inherent property of blockchain that it is immutable? And who should have the right, should patients have that right to modify their record if their health data is indexed on chain?
So that's a very good question, actually, because that's what I was asking him, Marshall, about, like, what happens when a doctor is sharing a data to a different doctor. See, there is a kid who was having an emergency, and the kid's doctor was not available in the city. And what happened is, like, we have taken that kid to a different doctor, and the doctor was not having the complete record what the previous doctor was handling it. So when we asked this doctor, right, he was not available, and later on we got him somehow. But he is not ready to share the data as because it belongs to a different hospital. So that was a very challenging issue. So what we did is, like, we already had the records electronic based with the child, and we were able to share it somehow with a different doctor. But if you say for example, if we give the complete control to the patient of the data, right, there will chances of manipulation will happen, definitely. So this, it will become a readable format for the patients. And read-write operations can be given only to the doctors who are authorized and within the same network. Say, for example, hospital A is having 6 or 7 branches with them, but they are not having an interoperability option. So once they have the interoperability option, right, even the same doctor who is working in the hospital with a multi-speciality places where you go and treat the patients, right, if he is having a separate clinic, that time he will not have the access to the data of the patient who is coming to the hospital A. So if he is coming into the network and creating an interoperability, then his clinic is also supposed to be mentioned there. So that was not happening. So we have created a platform where there can be a readable format can be shared to the doctor, even if he is not connected to the hospitals, even if it is clinics, right? So right operation cannot be given to everyone, as because once a data has been created, it can be modified only with the special permissions. Say, for example, a wrong information has been given, and some data need to be changed. It cannot happen without the permission of the admin or the person who is there in the major concern. There are different roles. So these roles has been defined how exactly we are handling the technology on the blockchain cryptocurrency way. So these definitely needs the roles, and with those roles and permissions only we'll be able to do it. Right now it's not happening, but this is supposed to happen because we are having trouble in having interoperability and the data manipulation which is already happening. Say the patients are already having a data in papers completely. It's a PHR records. It has to be converted to a EHR records. So that migration will take around 1 or 2 years to complete. Once the data has been completely migrated to EHR records, and that will be brought to the interoperability option between the hospitals which are connected to it. And then the network of doctors is being created, because what exactly we are doing is, like, whenever we are onboarding a hospital or a clinic, right, we are providing them a identity for it. It's a blockchain identity will be created on top of it. How exactly we are doing real estate on NFTs using blockchain and all, right? So it's the same concept. So using the same concept, we are creating identity for the hospitals and also creating the identity for the doctors. So once you have a verified identity for the doctors, right, this identity will verify the doctor where exactly he's got certified, what is clinical or the definitions of the numbers, whatever he is having, and other government records, which countries he's belonged to, how many hospitals he is connected to. So this will be published only to the doctors, not to the hospitals. And if the hospitals are having doctors and paramedical staffs, even the paramedical staff are also having the blockchain identity for them. And the roles which will be given to the paramedical staff in case of emergency if the doctor is not available for changing or modifying the data. But that will happen only with the approval of the same doctor. So this is how it's been designed as of now. If there is improvisation is required, then we need to go for the trend analysis where exactly it is happening. After a year of time, we'll be able to create we already have like 8 months of data from 27 hospitals, I guess, yes. So with those data, we already have a patterns created for those, all the trends. So with those informations only, at the back end, we have a data analyst who is working along with this. So the data scientist team is like 12 people are there with that. So each PHR records is been identified and converted to the EHR records. So that time only we got to know this paramedical staffs can also be included to it. This modification has been done only 2 months back. So we need another 1 or 2 years of data to understand how exactly it can come under certain regulations has to be created for it, certain roles has to be created. Even say for example in south part of India, right? When you go, sorry, north part of India when you go, and that too in west side and all, there will be a lot of people who are controlling the complete data informations. They can modify your physical health records for joining gym and all, and also some kind of manipulated information given, even if you're not admitted to the hospital, they are giving the discharge summaries. So this kind of things is not is happening without the knowledge of the hospital owners as well as the doctors. This paramedical staff is doing it because they have the access for the admin roles, whoever is sitting in the reception to provide the data whichever it is required. So we try to solve those issues through the NGOs, and then only we got to the plan of creating a blockchain identity for them, for the paramedical staff itself. Now we have the roles control, and we give them the access card. Without the access card, they will not be able to access even the places of the hospitals. So if they are trying to manipulate the data, easily we'll get to know it can be tracked by the doctors or even by the admins in the hospitals. So that's how the data has been shared and the control has been shifted.
Hi, good morning. I have a quick question for you, Doctor.
Yeah.
For the FDA and the CE marking, what you mentioned was, I totally agree with it. In the past, it was, I mean, easier pathway to go for EU. And what is your experience under the MDR, which is like very rigorous and it's like time consuming, and even to the state that the EU has extended the time for registration for the MDR, because until only a few months before the deadline set by the EU, it was only 15% or so of the companies have the MDR. So that's in line with your comment about to avoid FDA, totally agree. And I would like to hear your experience. Maybe it's good to share also some experiences, some good tips. How you approach this in terms of the new regulation, specifically the MDR. Thank you.
Very quickly, gentlemen.
Yeah. So we've been working with multiple aspects of like in Denmark and also in other countries called, there is in Argentina. Argentina was not now, it was like 2 weeks back only we got connected. But in Denmark, we've been working with the dental regulations, how exactly they are doing it. And there are certain aspects which we developed an application which is completely different from the standards what we follow from India. So it is easy, but it will complex, what do you call that, data or other things which need to be created on a different standards is completely different from what we follow from India. So we have created the standards on US based as of now, and also from India complete regulations we already have this information. But wherever we are trying to populate this, right, we need to understand more about from their end what kind of things that they already follow it. Because if we are generalizing the formats and giving it what we are trying to follow in one single country, that's not going to happen in other countries. So each and everywhere we do a market analysis, and also a complete case history will be done. It's like an R&D team. So we are having the help of NGOs who are working already for 12 countries. So they are collecting the data. It's under the process. So we have to do an R&D about their systems, about their records, how exactly they are sharing it with the hospitals. Like I said, how in Australia and small city, what kind of data that they are trying to take it. The first stage is like envisioning. So as we are talking about a lot of number of data, first phase we focus is the planning on the data side. Next is on planning the standards and regulations, how exactly it can be integrated with the current software from MedAvatar side. Third would be like in deploying this application to them on a test trial basis and to see what kind of trends and patterns will be created there. Once this is done, then we are good to deploy in other countries. Because without this research and development, right, we'll not be able to just enter into the market and show that. Because that's, you're trying to just sell your product. It's not your product that you're trying to sell. You are trying to solve a problem which is universally there. Once you're trying to achieve this universal problem, and if it is solved, you will have everyone an individual identity, and that will become the health passport. Wherever they travel around the world will be followed with a certain standards, and the data can be shared with any of the doctors. So people will not have any trouble in traveling, also taking care of the health wherever they are. So we wanted to identify and solve this problem. That's why we are doing all these things, because we know that it's a time-taking process. That's why we are connected with already 3 NGOs who are doing the help for us, and we are also funding them for taking information from them to proceed further for the other analysis and all. So this is how it is doing. But it's possible, needs time. As you said, it's a time-taking process, definitely. But we'll be able to accomplish it.
Can I have 30 seconds?
Thank you. Thank you so much.
30 seconds, yes.
30 seconds, sir.
Okay.
My experience is as an angel investor, I've been doing this for a long time, not my first rodeo. Very often, there's a focus on clinical data and the product. And that is supplied to the governmental agencies. And then they come back and say, what standards do you use? So very often, like in Europe, ISO standards, right? ESO standards. If you start setting up your standards for documentation flow, so set up the base, ISO, whatever, it's very painful. But once you get that integrated, then you get a fast track. But if they're going to come back to you and say, what standards do you use? Then you have to start again from beginning. So it's a process.
Thank you. It was good to hear someone still positive about the MDR, but yeah, thank you.
Thank you.
Thank you very much, gentlemen. Ladies and gentlemen, please put your hands together for the panel. Sadly, we're all out of time.
That's it.
We could have continued, I know, but thank you.
You're welcome.
All right. Let us please have the chairs removed from the stage for our recognition session. So, ladies and gentlemen, it is now time to recognize the healthcare professionals who really are to be celebrated as change makers, and we shall be calling upon Ms. Nada Badr Eldin, Academic Director of CGIE Consulting Group for International Education, to present the awards. Welcome, Nada. So you can stand. Nadia. Sorry. All right, so Nadia. And shall we put a little bit of music for the, I don't know, the mood? Okay, oh, there's not much light here. Podium light would have been good. Let's put on my, all right, there it is. All right, and our first awardee is Mr. Araj Hassan. Congratulations, Araj. CEO of V-Meals. He is a visionary entrepreneur with diverse industry experience and leading a multiple F&B brands like V-Meals, Nutristein, and Zen Garden. Congratulations, Mr. Araj Hassan. I believe he has an exhibition booth just outside with fresh juices for those of you who want to grab one. Congratulations. Next up, I knew there was some music. There we go. Next up, we have Akshata Dinakar. Dr. Akshata Dinakar is the medical director of Dermatics Clinic with accolades as a successful entrepreneur and aesthetic physician. Dr. Akshata Dinakar serves a prestigious clientele of celebrities and influencers in Dubai. Congratulations. Can we get the chair removed, please? It'll look better in the photos.
Good morning, everyone. It's such an honor to be receiving the Outstanding Leadership Award. I would like to thank Health 2.0 for this wonderful opportunity, and I wish all the other awardees a hearty congratulations. Cheers. Have a good rest of the day. Thank you.
Dr. Hassan, my apologies. Would you like to share a few words with us? Hassan Araj, no, we're good. Can we have the chair removed, please? The chair, if we can remove it. Yeah, it looks better in the photos without the chair. Okay, it's for the mic? Perhaps we can give the mic to the speaker. Yeah? Can we give the microphone to the speaker so we can remove the chair? Yeah, thank you. All right. Next, we have Andrew Norris, Dr. Andrew Norris, Chairman of Anesthesiology at King Faisal Specialist Hospital in Riyadh, with 22 years of experience as an NHS consultant to the United Kingdom, and he has held regional and national roles in postgraduate medical education. Congratulations, Dr. Norris. Would you like to share a few words, Doctor?
Oh, I guess we're all saying something, are we? Well, thanks very much for the award. It's great to be here. It's a very diverse audience, and I think that is healthy, as one of our speakers alluded to in the previous session. I think it's nice to be amongst different folks, some clinicians and some entrepreneurs and people from different areas. So it's really stimulating meeting, I think. I'm looking forward to the rest of it. Thank you very much.
We needed to have more techies in here, though. AI, data and analytics professionals. Are there any AI, data and analytics techies in the room? No? Yeah? Miss? Sort of. Okay. All right. Next up, Bernardo Arnault. Congratulations. CEO of Immunovax, bringing 24 years of diverse experience in international trade, telecom, biotech, and more. Bernardo is currently pursuing a postgraduate degree in society law and contemporary China. Mr. Bernardo? No? All right, we will hold on to it for Mr. Bernardo. Perfect. Next up, Mr. David Rollins. Welcome back on stage, Mr. Rollins, Managing Director of Digital Health Leadership Australasia, an Australian and international health informatics leader. He brings extensive executive management experience in health services and systems. Congratulations, Mr. Rollins.
Thank you. Thank you to Health 2.0, and thank you to everybody here who, it's great to be a part of such an innovative and expert community. And already I think this has been a very interesting morning. We've heard so much about innovations, we've heard so much about what's possible today as a result of things like technologies, standards, etc., which we weren't talking about too much too long ago. So it's very good for me to hear these words recurring all of the time. Thank you.
Thank you, Mr. Rollins. Very true. Technology taking more space. I don't know about that chip, though, how that would compromise patient privacy. Huh? All right. Next up, Mr. Essam Khalaf. Come on up. Director of Sales, Middle East and Africa at Certex Medical. With over 20 years of experience in the healthcare industry, he is a seasoned executive with a strong background in healthcare management. Congratulations, Mr. Khalaf. Would you like to say a few words, Mr. Khalaf?
Yes, please. Yeah. Hi, good morning, everyone. I'm really honored and humbled to receive this outstanding leadership award. And I'm in the medical devices industry, and I strongly believe in the partnership between the industry and the healthcare providers to provide new technologies to make patients' life better. So I'm very honored to receive this, and recognition, as mentioned by the great philosopher, German philosopher, George Hegel, that recognition is a mechanism of how our existence as human beings or social beings is generated. To make it easier, recognition is very important. To thank you, Health 2.0, for this recognition. I'm very glad to receive this and be among these alike minds today. Thank you so much.
Thank you, Mr. Khalaf. I'm sure you earned it. Congratulations. Thank you for your collaboration. All right, next up we have Mazen Daye. Congratulations, Dr. Mazen Daye is an IVF infertility consultant and the co-founder medical director of Best Life Fertility Center in the UAE. He has established IVF centers in various countries, including Russia, Syria, Sharjah, and Dubai. Fantastic. Attending to the reproductive medicine industry. Congratulations.
Thank you so much. I would like to thank Health 2.0 for this great event. Best Life Fertility Center, established in UAE, where all of us living the best life, really, the place for everything best in our life. So we will keep trying to help all our couples to make their dreams happen, and we will make it happen. So with your support and with your recognition, we will keep helps people to have their dreams. And thank you so much.
Thank you, Mazen. Congratulations. Ah, yes, the joy of childbirth for those moms out there. Next, we have an award for Mike Faili. Congratulations. He is the founder and managing director of Xantaris, bringing extensive experience in project management across the pharmaceutical industry, with a strategic vision for delivering clinical operations and outsourcing services. He aims to expedite innovative treatment delivery to patients by assembling the right teams and the right solutions. Congratulations, Mr. Bailey. Would you like to say a few words?
Thank you. First, I'd like to thank Sales 2.0 for the recognition. I'm incredibly humble and honored to get this trophy about leadership and outstanding. So as a part of the presentation, I think, for health and especially clinical trials, which is my baby, we are all here to improve patients' life. So I'm really proud to be here about this recognition and having such great speakers. So thank you.
Thank you, Mr. Mike Faye. I would like to call up on stage Muna Al-Haddam Rami. Muna is the Facilities Director at Ambulatory Healthcare Services, AHS, for SEHA, overseeing integrated maintenance services for AHS facilities. With a remarkable track record, she led the establishment of award-winning national screening centers and vaccination centers during COVID-19 pandemic, playing a vital role in curbing the spread of the virus. Congratulations, Muna.
Thank you so much for appreciating my responsibility, and thank you, Health 2.0, for everything.
Thank you. Muna, for those who are traveling from abroad and who don't know SEHA, can you tell us a bit about SEHA?
SEHA is the healthcare services company in Abu Dhabi. It's taking care of all public hospitals and healthcare facilities in Abu Dhabi.
Yes, it's the main hub. Thank you. Next, we have an award for Nasser Al-Khelaiwi. Mr. Al-Khelaiwi is the Vice President of Finance and Administration of Riyadh 3rd Health Cluster, Ministry of Health. He's a highly accomplished finance leader in healthcare, transformation management, driving financial excellence in the healthcare sector. Congratulations, Nasser, and welcome. Saudi is doing incredible things.
Thank you very much. I'm very excited and glad for this recognition. Thanks for MOH 2.0, Health 2.0. Thank for you for this warm welcoming. Besides being a finance, probably you guys are the subject matter experts in the health on the field. But I think it's very beneficial for myself to share the knowledge of a finance guy who moving not only for bookkeeping roles, but I think we are moving into more insightful roles, into moving the healthcare systems into value-based healthcare. We are having a very ambitious transformational journey in Saudi Arabia. I think finance is a key pillar to move this journey into success for the well-being of people, families, friends, and daughters and sons. I'm very happy to be here. Thank you very much.
Thank you.
Thank you.
Thank you. And we are very impressed with everything that Saudi Arabia and Saudi Vision 2030 is doing. All right, next up we have Sarfraz Ahmed, an award for you. Come on up. Dr. Sarfraz Ahmed is the Associate VP of Abir Medical Group, an accomplished healthcare entrepreneur with over 15 years of leadership experience in the GCC. He prioritizes exceptional patient care and value creation for stakeholders and tried and tested methods to navigate the VUCA world. Currently based in Jeddah, Dr. Ahmed leads the group operations Pan-GCC.
Thank you so much, Health 2.0. Well, I've attended a lot of conferences, but I think this is the first where I've seen clinicians, entrepreneurs, techies, and finance all in the same group. So I think this is going to be an amazing conference. Thank you once again.
Thank you, Dr. Ahmed. Shaz Mahmood. All right, we will hold on to it. Stephanie Chu Huying. Stephanie? Oh, there she is. Take your time. Stephanie Chu is the visionary co-founder of Baseline Fitness Singapore, a fitness startup specializing in unique programs for clients and corporate health solutions. Certified personal trainer and senior exercise specialist, she prioritizes her diverse clients' needs, offering effective and sustainable fitness solutions. Welcome, Stephanie, and congratulations.
Okay, I'd like to thank Health 2.0 for the opportunity and recognition. I have to thank my partner in life, Vignesh, who is also co-founder and coach at Baseline Fitness Singapore, who couldn't be here today. Without his love and unwavering support, I wouldn't be here. Baseline Fitness' mission is to radically change and shift perceptions and understanding about health and fitness, one individual at a time, one organization at a time. We do this through one-to-one fitness coaching and also fitness consultancy. We feel that the fitness industry is part of preventive healthcare, and we would like to be part of that ecosystem of the healthcare continuum, and to make fitness and fitness coaches and professionals like ourselves be in the doctor's thoughts, be part of the healthcare system as part of preventive medical care. And that is the mission that we like to achieve. Okay.
Thank you.
Thank you.
Stephanie? Next, we have Mr. Tetsuya Yamada. Tetsuya Yamada-san is the Managing Director of Omron Healthcare India, bringing extensive experience in global product planning and across-border M&A. With a passion for addressing social issues in the medical environment, his goal is to achieve going for zero, eliminating cerebrovascular, cardiovascular diseases, respiratory diseases, and chronic pain limitations in Indian society through innovative healthcare products and services. Congratulations.
So, hello everyone. Thank you for having me today, and thank you for this great congress. So, as she explained, we are the company, we are Omron Healthcare. We are the company who are providing home healthcare devices and also solutions. in order to achieve the going for zero. And then in India, especially for India, over 2.5 million people die every year because of the cardiac diseases. And also over 1 million people die every year from the asthma and also COPD. So we are very seriously committed to solve this issue, and then we want to achieve it. And then, of course, we cannot do alone. So we want to collaborate with pharmaceutical company and also startup companies who are providing remote patient monitoring. And thank you for this opportunity. Thank you very much.
Thank you. Thank you for your cooperation and collaboration, Mr. Yamada-san. Yes. And last but not least, let us welcome Somaye Seprandana Sab on stage. Somaye has 14 years of anesthesia experience, and she is skilled in bariatric, pediatric, and cosmetic surgeries. A strategic decision maker, she's dedicated to team-focused growth, and as a co-founder of Jewis Technology, she pushes the boundaries of innovative product creation.
Hello, everyone. I would like to thank Health 2.0 for this opportunity. At the end of the day, we're all here to have one common desire, and this is the impact lives for the better. So cheers.
Thank you, Somaye. Congratulations. Congratulations to all the awardees. Thank you, Nadia, for being on stage with me. Thank you, and presenting the awards. We wish you the best of luck and for your future pursuits. Before we break for lunch, ladies and gentlemen, I just want to remind you to keep it engaged and do post on social media by hashtagging the conference, Conf Health 2.0. And we've prepared a delectable feast for you just outdoors. I just want to remind everyone to reconvene here at 1:30 sharp, so in an hour and a half. Thank you and bon appétit. next panel, Mira, Rainer, and Dr. Feroza. Are there stairs there? Why would you want to go through the doors? Oh. No, the microphones, I mean, if you want to get the plug-in or with the handheld, because the handhelds are here. You don't, yeah, no. Yes, we need 3 chairs, please, before we can commence. 3 chairs. Da, da, da. Welcome back, everyone. Who has flown in to Dubai? Yes, from where? The US. That's a long flight. 15, yeah. Anyone further than the US? No. Oh, wait, Australia. I know someone's here from Australia. I wonder how long that flight is. Probably about the same thing. Yeah. Okay, 3 chairs, sir. Thank you. Did everyone enjoy their lunch? Yeah? Good. Time for coffee. Okay, and 3 microphones. Yeah? We need 3. They're there. Yeah. All right. Welcome back, ladies and gentlemen. I hope you enjoyed your lunch. Good. So did I. Did you try those little chocolate rectangles there? Dangerous stuff, I tell you. With medical tourism becoming increasingly popular around the world, people are traveling to other countries to receive healthcare services. Dubai, in particular, has emerged as a popular destination for medical tourism. In our upcoming panel discussion on the topic Dubai as a popular destination for medical tourism, a model to replicate, the panelists will discuss just this, the model in other countries and the implications for health systems and services. All right, so please put your hands together to welcome our moderator, Mira Ashkar Ruhana, Medical Insurance Director at Fidelity Insurance Services. Welcome, Mira.
Thank you.
The panelists, please welcome Rainer Bulsinger, CSO and CMO at Art of Cryo by Eleanor Kalter-Technik. And last but not least, Dr. Feroza Dawood, Head of Department of Obstetrics and Gynecology at Mediclinic Airport Road Hospital for this panel discussion on medical tourism and Dubai, the place to be. All right, the floor is yours. Let's set the timer, please.
Okay, good afternoon. I'll start with just introducing everyone that we have on the panel, and then of course you guys can add to it if you feel I haven't done it justice. We'll start with Dr. Feroza Dawood, a British consultant OBGYN and head of the obstetrics and gynecology at Mediclinic Airport Road Hospital, Abu Dhabi. Dr. Feroza has collaborated with international colleagues to conduct clinical trials and research in recurrent miscarriage and diabetes in pregnancies. She has a master's degree in international healthcare and leadership from Manchester Business School in the UK. She is also a peer reviewer and a member of the Maternity Advisory Group of the Department of Health in Abu Dhabi with a remit to continuous improvement in women's health from birth to menopause. Welcome. Thank you, Mira. We also have with us Rainer Bulsinger, who holds a Diploma Kaufman from FAU. Rainer is the Chief Strategy and Chief Marketing Officer of Art of Cryo, a brand by Eleanor Kalter-Technik. He holds a long track record in international business all around the world in areas like medical, rehab, hospitality, sports and fitness, and lifestyle solutions, and the chair of the Cryotherapy Initiative of the Global Wellness Institute in Florida, US. Welcome.
Thank you very much.
Lastly, I'm Mira. I'm the Medical Insurance Director at an esteemed insurance brokerage in the UAE. My goal is to forge a path towards inclusive healthcare for every resident. Thank you for having us on. A quick overview of the topic that we have at hand, medical tourism. So medical tourism in Dubai has experienced significant growth in recent years, establishing the city as a prominent destination for healthcare travelers. Boasting world-class medical facilities, skilled healthcare professionals, and a vibrant tourism industry, Dubai offers a unique blend of high-quality medical care and, of course, luxurious travel experiences. While specific statistics may vary, Dubai's medical tourism sector has witnessed a substantial rise in the number of international patients seeking medical treatment. According to the Dubai Health Authority's data, in 2019 alone, the city welcomed approximately 350,000 medical tourists, and in 2022, approximately 674,000 medical tourists. These individuals sought various medical procedures such as advanced surgeries, specialized treatments, and wellness services. As the sector continues to evolve, Dubai remains at the forefront of providing world-class medical care and unforgettable travel experiences for patients from around the globe. We'll now dive into some questions for our panelists. I think we should start with maybe ways on how to define medical tourism. I think, Rainer, you might want to take this on.
If we take the definition by the Dubai Economic Ministry, they separate it in doing tourism for urgent reason to get treated on an indication. The second way is to do it for a reason which is not urgent, like dental care or more aesthetics. And the third one would be wellness and well-being, longevity. Says we talk more about preventative.
Thank you. And what factors would you say contributed to Dubai's rise as a popular destination for medical tourism? I think maybe Dr. Feroza would also want to add to that.
Yes, thank you, Mira, and thank you for the lovely introduction. I just want to start off with a disclaimer. I am not by no means an authority on medical tourism. I'm an obstetrician and gynecologist. I practice at Mediclinic Airport Road in Abu Dhabi, the capital of the UAE. But of course, Mediclinic Middle East is also based in Dubai, Al Ain, and then it has international branches in South Africa and Switzerland. And my day job is a practicing clinician. I love delivering babies, and I look after patients from delivering their babies right until menopause. And in my experience, I have noticed that I'm very passionate about women's health. I've noticed patients are now moving their focus towards preventative health care. We already have cervical cancer screening, we have breast cancer screening, but now patients are moving towards preventing, trying to also delve into cosmetic procedures, especially in my field, cosmetic gynecology, dermatology, etc. And so I see now there's a move towards this so-called medical tourism, not only from outside Dubai, but also from within the UAE itself. As Rainer said, largely they are elective procedures. And Dubai, from statistics from the Dubai Health Authority, in 2022, I think it was quoted that the financial derivatives of medical tourism was in excess of 1 billion dirhams. Why Dubai? I think because Dubai has a very good strategic geographical location, easy to access from most parts of the world, especially Asia and Europe, and then of course the GCC countries as well. So I think this is what makes Dubai a popular medical tourist destination because of its location. Just to answer your question a little bit more completely as well, the main areas that we see a burgeoning interest in medical tourism is cosmetics. So this includes aesthetics, so plastic surgery, dermatology, cosmetic gynecology as well, then dentistry, in particular cosmetic dentistry, and the last one is in cardiology as well, and orthopedics. Also gynecology, especially elective gynecology, such as IVF, but as I mentioned before, cosmetic gynecology as well.
Thank you.
May I add, I think Dubai has two more competitive advantages. First one is infrastructure. You have outstanding equipment there and a very high level of treatments. And the second and maybe even more important point is it's super international and gives easy access for everybody. Wherever you're coming from, we will be attended in your mother tongue, which is very essential, especially if it comes to serious health problems, that you have built a trust with your customers.
Thank you. And what are the key advantages of Dubai's healthcare system that attracts international patients? I think this one ties into what we've already said in terms of like state-of-the-art, international doctors that visit as well. So how would you categorize medical tourism, Rainer?
Yeah, one can distinguish by fields of treatment, let's say by indications. Is it dental? Is it beauty? Is it whatsoever? It can be defined in the way how a facility is organized. Am I traveling to a place and hospitality is included, so I have in-house services, or is it done by collaborations that I have a luxury hotel with a concierge, a health concierge that takes care of me and brings me in the distinguished, different specialized facilities, and the treatment aim itself as we did before.
Thank you. And how do you believe that Dubai ensures the quality and safety of medical services that are provided to international patients?
May I answer that? Yeah. So the legislative body is the DHA, the Dubai Health Authority, and there are specific and well-defined objectives that medical facilities need to abide by to become a destination for medical tourism. So one of the most important aspects is certifications of the medical center, also international accreditations such as JCI, a Joint Commission International. Indeed, Dubai has one of the largest number of JCI accredited medical facilities in the world. So again, making it a popular tourist destination for medical treatment. In addition, medical facilities need to declare their number of beds, their number of physician-to-nurse ratio, and all the treatments that are available as well. So I think it is fairly well regulated, and the quality and the standard of medical care that is delivered as well comes under scrutiny from the Dubai Health Authority.
Thank you. And in your opinion, what aspects of Dubai's medical tourism model could be replicated? I know that, Rainer, you're based in Germany.
Yes.
What parts of the tourism model in Dubai do you feel can be replicated by other countries or regions? I've put you on the spot.
Yeah, it always depends on each model. There are so many diverse of those. I think the basic infrastructure must be given the attendance of the people.
Right.
Like, I just can repeat what I said before, and afterwards it's getting very, very specific
Right.
if you're looking at the service that is provided. I think in general, let's maybe strive there another point. Dubai and the UAE is known for being very progressive, future-oriented, tech-oriented, and I think this is a huge advantage, especially in modern medicine when it comes to AI, big data, having integrated services. So something that we are doing as well. We integrate different treatments as a company with measuring and software around. And I think Dubai is just the right place to push for the future. And that afterwards can be adopted by other countries that suffer more complicated or especially slower regulations. As here, decisions can be taken on a very quick pace is a huge advantage, while in other countries the process to adopt to these new technologies is much longer, for example.
From a health provider's perspective, what strategies or initiatives have been instrumental in establishing Dubai as a prominent medical tourism hub that you are aware of? I know that.
Yeah. I mean, again, I will echo what Rainer has said about the innovation, the embracing of advanced technologies. I think a lot of healthcare providers are kind of intimidated by artificial intelligence. You know, nobody wants their job to be replaced, but I think it is the future, it is the present as well, it's happening. And the way I see it is artificial intelligence is adjunctive. It is helping us improve diagnosis. It is helping us, scan multiple thousands of images, etc., something that humans cannot do. But Dubai is very good and very well placed to do this because Dubai kind of, you know, the speed of change, it's plain to see, even kind of, you know, buildings and development and infrastructure in the last 2 decades, Dubai has metamorphosized. And that applies to the medical field as well. I think you may also be aware that Dubai has launched the Emirati Genomic Project earlier on this year because they are moving towards, again, mapping out DNA for the local population and then beyond. You know, so again, I think Dubai is one of these cities that really strives and embraces change rather than being intimidated by change, and is really actively embracing technology.
Thank you. Rainer, what offerings do you think are provided that can contribute to medical tourism? So specifically, you can speak about your own offerings if you'd like.
Yeah, we are the leading manufacturer of a whole body cryotherapy solution since a long time, so we know that we dominate that. But we also realized that you have to offer a little bit more. So first we started to have individualized treatments, yeah? Not one treatment fits all. I think this is a huge topic in all fields of the medical. We talked about differentiation in between female and men. There is not one solution fits all, so I totally agree what you said before. But it's also age that has an impact. For example, if you talk about whole body cryotherapy or skin type, how sensitive are you to cold? So we have a software that calculates your individual treatment time. That was the first step. Then we developed another 2 products that round it up. You can hear that everywhere in biohacks, combine warmth with cold, but do it the right way. You should not sweat before going to the extreme cold. So we designed a product which we call multi-cryo hacking system, which is a composition of different treatment levels coming together. Deep tissue warmth by far infrared, different light therapy, 2 times red, 2 times blue, 2 times green, which you can mix up depending on the program and the treatment aim. Let's say you can do 80% red of the one red and 20% of the blue. At the same time, we give you oxygen ions generated by 3 different generators in a super high dosage of up to 15.6 million per cubic centimeter. Very nice for this region here, especially in this part of the year. And a quick air evacuation system, which allows us a quick temperature drop, for example, to promote collagen synthesis. So all the things are coming together. Then you go to the cryo, and afterwards we designed like an artificial lymphatic heart that you are striving in to increase the flow in your body. So all 3 things together are very nice. Then that's not all. We said, okay, there must be some measuring, give a feedback to the customers. We started integrating a body scan and a smart ring, where the customer gets a direct feedback, and you can go through that with your customer. So there's two levels. One's for a nice consultancy, depending what kind of services you provide. In the medical field, obviously more deep than if you talk just wellness. But at the same time, the customer has the same data and can compare before and after all in one app that he's using for booking as well. Here we come to the point with the booking and this data. If you take the smart ring with you and you still have the logo from your Dubai healthcare provider and you're traveling back to Europe or Asia or the States, you still stay in touch with your last experience and you're eager to come back and to see how is the evolvement of these measured data compared to before. And that's just the beginning, so there's much more planned to come.
And Rainer, Dubai has now the first hyperbaric oxygen center in the world, I believe. Does your company work close with hyperbaric oxygen treatments as well?
Many of our customers work with HBOT, and it's a super treatment, and the combination in between cold and HBOT is perfect. So we started that as a platform that shall be open for other treatments. Good that you name it. I have one customer who is at the moment conducting a study on long COVID and COPD using cold combined with HBOT. So it's a hot topic everywhere. And let's see, at the last Global Wellness Summit, there were 2 top topics. That was cold and HBOT in the end as technology. So that goes pretty well together.
Yes, indeed. Thank you. So now we've discussed all the several factors that contribute to placing Dubai as the hub for medical tourism. Can you think of any limitations or challenges?
So I think one of the key challenge that patients face is sometimes insurance issues, especially if, so either the local or the international insurance, and perhaps you could elaborate on that, Miva, because you're an insurance expert.
So based on how insurance works here, obviously the only members who can purchase it are residents only. So those coming in from abroad have to already be holding something that has international coverage. In terms of medical rates, I know that Dubai versus other markets is more competitive, although those living in Dubai will tell you there's nothing here that's priced competitively. But from what we hear from the medical inflation abroad, it seems to be happening globally anyway. We do know of some patients who have come in because the provider had offered pro bono coverage, which means they came in from either Asia or Africa and they were given some pro bono work that was done to their treatment. They were mostly cardiovascular patients. But unfortunately, this is the limit to the information we have because obviously most of these cases have patient confidentiality regulations on them. So in terms of, I guess, other factors of challenges, it's hard to put your finger on it now because I think we're right now in the middle of seeing it grow and it's exploded to this really a hub for medical international patients. But it's interesting to see how the next couple of years will roll out, how we will grow, how the Dubai, let's say how investments are placed in the medical providers to encourage international patients. I know that marketing is being done abroad as well from providers' point of views. They're heavily marketing towards international patients, but it's a great space to be in right now.
I think we will face a similar development as you have with mobile contracts, with your mobile phone. Yeah?
Right.
First that was very concentrated on a certain country. Right. Now it's already areas and you have offers that you directly have an international coverage for that. I think we'll face the same.
I mean, we already have teleconsultation, so you already have telemedicine happening, right? So definitely, I agree. Yeah.
I mean, the DHA, the Dubai Health Authority, has launched early on this year the Dubai in One Day healthcare journey. And, obviously they're trying to promote the whole patient experience and trying to attract patients to come and have a little bit of a leisure time as well. And then whatever their medical concerns are or their cosmetic needs are, to try to address that at the same time and trying to facilitate that. But as I said, going back to some of the barriers, one of it is insurance. Do you know of any kind of steps that perhaps insurance companies are undertaking to work in collaboration with medical facilities, perhaps?
I only know of the major international insurers that do tie-ups with providers, so therefore offering members, a specific discount rate if they are availing any type of medical treatment at that provider level. But other than that, every market comes with their own regulation, so it's very hard to, I guess, narrow it down and say this is a one-stop shop and this is the solution for it. But there are definitely discussions from the marketing side of even insurance companies trying to tackle this to make it, let's say, more attractive for them to come to Dubai, definitely. And we're seeing that. I mean, I think every industry has seen an influx of, new families, new companies opening up shop here. So it's definitely, we are on the right journey and the right steps forward.
The other thing that the Dubai Health Authority has now promoted is this well women packages, well men packages, and focus now moving to preventative health care as well. I think the prices are quite competitive.
Yes.
And they're trying to help patients again prevent disease before they occur by using advanced technologies, AI as well.
Yeah, because unfortunately no one is actually focusing on preventative health. It's always going to the doctor when it's, you're already having symptoms, right? So for it to be covered under your insurance, it needs to be medically necessary, right?
Absolutely.
I don't agree totally on that. It's just growing from the different part. We are talking about medical and tourism.
Yeah.
In tourism, we have a long development during the last decades that it's getting more preventative, and that brings certain pressure to the medical market. At the same time, the medical market gets more like hospitality. You could see that already like 25 years ago in China. If you look at the good private hospitals, you think you enter in a 7-star hotel. Yeah? Right. So depending on the areas, and maybe to add one point, I think Dubai has another advantage. you're not so stuck in a fixed system in Dubai than in other markets, because it's more open to all different kinds of approaching a disease, which is also a nice point of differentiation. Let's say if I have a medical problem, I can get the classical treatment and combine that with other offers in a very, without having big distances all at one place.
Yeah, I mean, to add to that, in other markets, if you want to see a doctor, you might be on a wait list. You wait months to see a surgeon. In Dubai, one of the advantages is if I want to see someone today, even a surgeon, I'm probably able to step outside right now and book a consult with a surgeon in the next 3 hours. And I'm not placed on a waiting list, or I'm not put on a months-long waiting list. And I've seen that evident in Canada only because I've previously lived there, but I think it happens in other markets as well.
Yes, yeah, for sure.
We're happy to take questions from the audience. Yeah, please. I think there's a mic stand in the middle. Just come forward. It's questions. He has a notebook. Oh, it's only one?
Bless you, panel. Thank you so much, Mira, Dr. Feroz, and Raina. This better be a good question. Everyone's waited for me. My name is David Golding. I'm the founder of Sober Lifestyle Coaching. We work in the field of addiction and recovery, and we're launching a day hub this year. But my question to the panel is the growth in medical tourism solely due to entrepreneurship, or is it a true collaboration with the government where they are helping drive the growth? Thank you.
I didn't hear the whole question. Okay, just repeat the question.
Is it mostly due to government or our entrepreneurship that we're having international patients? I think it's a bigger mix.
Answer it.
Yeah, go ahead.
I think it's both at the same time. The big advantage of Dubai is if there is a very interesting field discovered, you have it from the governmental side and institutional side pushed in a very strong way, and platforms is given, and bringing the execution on the entrepreneurial level together. In general, you can say this is now not only Dubai specific, worldwide medical tourism, and the awareness for longevity, preventive healthcare, differentiated healthcare on ladies' healthcare, a focused big problem that finally is focused, and so on. So it's a global development that cannot be stopped, which is here supported and even more accelerated by the government, and attracts entrepreneurs from all around the world to be based here and to have the nice infrastructure on it.
Yeah, I think it's fair to say if something is booming in Dubai, it definitely has the support of the government. So there's definitely some immense support.
Yeah, no, so both Dubai and the Abu Dhabi Health Authority, the Abu Dhabi Health Authority is Department of Health, the Dubai Health Authority is Dubai DHA. Both of them are actively working to support and promote medical tourism, wellness, etc., through public and private collaborations, and even international collaborations. So you see some hospitals in Abu Dhabi that have linked up with well-recognized international hospitals such as Mayo Clinic and Cleveland Clinic. Again, just to reassure patients about the quality of services that are underpinned by these international collaborations as well.
Anyone else?
Great discussion on medical tourism. And my question is for the panel. We have spent some time discussing medical tourism as mostly attractive for elective procedures, aesthetic purposes. But Dubai is unique. It is one of the most visited places on the planet. So should we be talking about medical treatment for tourists as part of this discussion? We have people coming in and out of the country, and those people will inevitably need care. And it's not going to be aesthetic care. It's not going to be elective procedures. They may find themselves in situations where they need acute care, and perhaps they don't have the adequate travel insurance to cover their need acutely. because Dubai is a unique place where we are seeing such an influx of people, should there be pressure on the Emirate to develop infrastructure for treatment of tourists visiting the country? And what would that look like?
I think this is already existing. So it's a good point, but in the very beginning they said you travel for medical indications, so that is what you refer to, that I have a specific problem and I travel for that specific problem for whatever reason, because there is not the adequate services available in my country. I have too long waiting times till I get really an appointment or whatsoever. So this definitely is an essential part of medical tourism, and let's say the purest form of medical tourism besides the elective and the more well-being and preventive care solutions. There's a homepage where even is referred to different clinics in the UAE, I think.
Yes. So the DHA has also an online portal. So patients people come in as tourists can, if they need acute care, can actually access that. So we started off with elective surgery and elective care because this is kind of, cold cases. Patients are coming, patients or clients coming to Dubai for a specific treatment. But of course, the government wants to support the move towards embracing all aspects of clinical care. And certainly they can do that via the Dubai online portal.
Are those at only public providers, or are they open to?
They're both now.
Oh, okay.
So as I said before, medical facilities need to register with the DHA to be able to provide this care. But certainly acute care, if a tourist goes to a public hospital, they would not be denied the care. Yeah, of course. Yeah.
Go ahead.
All right. Thank you very much for the interesting discussion about medical tourism. I am in medical sales, so I'm at a high level engaged with hospitals in Dubai and other countries. And I think I need to take your opinion about what is some challenges facing medical tourism in Dubai and UAE in general, which is, even though you have the high quality of standards, and of course Dubai DHA and Siha are having great programs to promote this, but still the cost of treatment compared to other countries in the region or in Asia, for example, is slightly a big challenge. And another challenge that I need to take your opinion about is the outbound tourism. That's the locals here, especially in UAE, flying outside the country for treatments into Europe, which is somehow challenging despite the programs and the Cleveland Clinic, Mayo Clinic, all these affiliation, still it is an issue. Do you see, from your expertise, any plans or programs to retain those locals, and is there any future for this, attracting more to find alternative ways for pricing and providing the value-based healthcare for other people from outside UAE? Maybe a complex question, maybe you forgot what I'm asking about.
Thank you.
First, the question is about what Dubai is, like UAE is doing, from your expertise, to retain the locals who fly outside, especially for high-end procedures, very technical, complex procedures. Still, that's an issue we see in the medical field. This is happening. And the other point is how to compete against, I would say, less expensive markets in the region, also trying to promote medical tourism as Jordan or India, definitely, or even Egypt at a very slow scale. But there is a lot of pressure on this. Thank you.
Thank you. That is a very complex question.
Yes, indeed.
I'll try to, I will start by answering the first part of it. I think the government is very aware that maybe 5 or 10 years ago, the local population seeking themselves being medical tourists at other destinations was much higher than it is now. So it's still happening, I agree with you, but I think if you look at the statistics, it is improving. And with the launch of the, for example, the Emirati Genomic Project that was just launched a few months ago, it's one of the reasons, like a ploy to try to discourage the local population seeking care elsewhere. There's also now a dedicated preventative screening program for the local Emiratis, again, to discourage them from seeking healthcare outside of the UAE. But I think it's a work in progress. You know, again, I'm not a health authority here. From my experience and from what I know in the field, it is improving. And the governments are really committed, both Dubai and Abu Dhabi are committed to trying to reduce that to zero. The other aspect about the cost, for sure, medical treatment is costly. Equipment is costly, but I think as technology is improving, I mean, I remember when we were doing simple genetic tests for like chromosomal abnormalities for pregnant patients, the cost was really prohibitive. But now with new generation sequencing machines, etc., the cost has gone down to maybe 10% of the original cost only a few years ago. So I think with technology, the cost will also drive down. But yes, there are challenges. Perhaps Mira can answer a little bit more about the cost from an insurance point of view, but that is quite complex.
Yeah, I mean, even from an insurance point of view, it's very complex. What I was just going to add is that also bringing in all these visiting doctors from abroad, so globally renowned doctors that are brought in and then marketed through the providers that they're working at, that's part of them bringing down, locals seeking medical tourism abroad. That's one aspect of how it's done as well. With regards to expats going back to home countries to seek treatment, that's got a lot of factors to it. Does the patient need recovery time? If yes, probably would want to do it in home country where there is support from family. So we have to just keep in mind that the population is heavily expat, and those that go back to home country, it's more than just medical rates or costs. There's the recovery aspect of it. There's the comfort. If the person speaks another language and is more comfortable back home, there's that aspect of it as well. Of course, there's also the insurance aspect. If it's an excluded item or just happens to fall under the regulator's exclusion list, then going back home and paying out of pocket becomes the most next logical thing. So I think it is definitely a loaded question because there are so many different ways to have answered it. There's so many layers to it. But hopefully we've addressed your question.
Thank you.
I would add there, if there's no competition, there's no market, because you referred to the lower end and to the higher end at the same time. So I think one of the advantages of Dubai is that there's a very, very big variety of services offered. And if there is a field where the people still have a need to travel outside, that's then a sign to detect we have to get there better. And it's only good to learn there. And you never can be the best in all fields because the medical field is much too high. And on the lower end, many times you have specific markets that have a reputation for some specific treatments on the lower price level, let's say dental health, for example, or aesthetic medicine and so on. It's always a question, are you ready to pay a little bit more money and do it here in Dubai and be assured that all the surroundings is organized in a very well way? Because next advantage, here you have this organized and controlled. Or do you risk to go to a country where you might save some money, but if you're making the wrong choice, you also have to live with the results that you get out of that. So last point to that, maybe as an idea, I think a good health concierge service can be very helpful to the internal and to the external audience, because if you have the right guidance, this in the medical field many times is the most complicated question for people that are coming from outside the sector, I feel many times.
Okay. Thank you. Very good. Thank you very much for the answers. Thank you.
Yes, of course.
Hi, I'm Sujin from 99 Infosystems.
Hello.
We didn't really talk too much about mental health, and most of the time when I think of this industry, the Nordic countries, even Germany actually, is very strong in that field, and during and post-COVID, lots of people have developed new mental health issues. I don't really hear about that in this area, the MENA region. Is it maybe government-based, or is it more cultural, or do you have any insight on that?
I mean, I think because the topic was medical tourism, we didn't touch on mental health because I wouldn't say international patients that were coming in were to seek that type of treatment. But it has definitely been a hot topic of discussion post-pandemic. I do know that the DHA has been, let's say, trying to pass regulation to mandate at least a minimum coverage of mental health, even on the most basic insurance policies that are purchased in Dubai. So I do know that that's underway. And soon to be mandated, which would be great. So it's definitely not maybe as taboo as it was a few years ago. I think, unfortunately, we had to learn the hard way that it's an important topic, but we're definitely moving in the right direction.
Yeah, regarding mental health, it doesn't lend itself so easily to medical tourism because, obviously it is in most cases a long-term relationship between the doctor and the psychiatrist or the psychologist. So it's not like a quick fix. So, it might not be in the patient's best interest to seek medical tourism for a mental health aspect. Of course, now with post-COVID, we have telemedicine. So maybe that will lend itself to a better communication and a better long-term relationship between the doctor and the patient. But again, I think for mental health, you do want this face-to-face interaction. The patient needs that, in my opinion. I think, of course, mental health needs to be addressed, but we cannot then safely say, oh, come for mental health, and then not follow up the patient appropriately. I think that would be doing a big disservice to patients. And that's one of the challenges, I think, with mental health and in terms of medical tourism.
I think it's already there, and it was a long time before there in the third column that we talked over before. This more falls into the category of wellness, well-being, prevention, and longevity. As I mentioned in the beginning, in the Global Wellness Institute, there's an extra initiative on mental wellness already existing since the time. So it's something that is evolving. Let's say, I think we have here one famous man coming from the yoga, for example. Yeah, so that can be one way to approach mental wellness. Meditation is offered in many places. This is something where you can do a lot for your mental wellness. Cryotherapy is outstanding if you have sleep disorders, for example, or if you want to have a quick fix. The only thing I can promise you, if you do cryo, after 3 seconds, you have a cool head. Yeah? So there is many things that are already offered that contribute to medical wellness, mental wellness, sorry. I totally agree with what you said. If you have already a strong indication, a medical, psychological indication, that then probably tourism is also not the right answer because you need a long-term treatment. That is a different story. But especially what you referred to, the impact of COVID, loneliness of the people and anxieties that came up, there is a lot of offers in totally different directions.
Thank you. Can I add like a quick addition to that?
Go for it.
So, like I said, Nordic countries do have 6 to 12 month, even longer programs to deal with.
Yeah.
Sorry. So Nordic countries do have longer programs where they sponsor the visa so you can stay in the country with the insurance that kicks in. I was just wondering whether Dubai and this area in general is also thinking of moving towards those kind of services eventually?
I think that's a movement that's going to have to be done from a government body or a regulator, health regulator. So as of now, there isn't anything that's been released in that sort. Only the aspect that I just mentioned, that they are talking about mandating it in even the most basic policies. So we have already evolved to a better, more focused mental health market. That's for sure.
Thanks.
Thank you.
Thank you. Very nice discussion. I'm Dr. Jane, Angelina Darakjian. I'm going to comment what it's been said. I'm coming years in Dubai as a functional medicine, as I said, and connected around 5 years with Open Mind Psychiatric and Neuroscience Center. We already connected with the ministry. We are connected with, mental health by all means. And we are insurance as well and medical tourism. So we are welcoming everybody. Even with the COVID, we were 24/7 working so hard online to help the community. Thank you.
Thank you.
Yeah, I believe it's a last question, I guess. So
Very interesting discussion. So I'm curious to see if you face any challenges in your own respective stuff with respect to adopting new cutting-edge technologies versus trying to keep the cost low for you to be continuing to be attractive for the medical tourism. So how do you balance these two out in your respective areas? If you can comment on that.
Do you want to answer?
Specifically, what we are doing, we are having a luxury product, which is very exclusive if you want to have it at your home. Let's say this is a very, very small cap of people that can have that. At the same time, we can build the product that you can have many, many treatments with the product, which drives the treatment cost per treatment extremely down. So it's very accessible. Let's say we have customers from the public thermal bath, that's in, let's say in Europe, lowest price, and then the super exclusive place where you pay for the same treatment like 12 to 15 times more. Like with every offer given, quantity can be one factor, depending on the operational cost per treatment. I think price should not be too much the focus here. There's other places that focus on being only economic. I think here it's quality. Quality means quality of the single treatment, but also quality of the setup around and quality of the offer in a wider field and how the people are treated and so on, and to keep a certain standard. I don't know another city with as many five-star hotels as Dubai, I think, or the Emirates in general. So I wonder a little bit why the third time now we hear price. Price is such a critical point. A good service also has a price and can have a price, because cheap can be expensive in the end.
Yes, go ahead.
Or did I not get your question in detail? I was not so sure if I'm getting the point. As you have seen, it's hard to understand sometimes when you're speaking there up here.
Yeah, just a follow-up to that, because I remember at the beginning of the conversation you mentioned that you are able to attract many people from countries like Asia, countries in Asia and other places, where generally the costs are lower, right? I understand some of the advantages to Dubai and why medical tourism is more attractive here. But I would assume, and maybe that's a wrong assumption, is cost also becomes one of the critical stuff in order to continue to be attractive. Not the lowest cost, but competitive cost enough, right? So, and that's the reason why I'm curious, because as you adopt new technologies, of course the costs are going to keep on escalating as it happens in other Western countries. So the curiosity is, how do you manage those two things? Because other countries, other European countries have not managed it, right? And that's the reason why you see many people coming or going to other destinations for care. So
we with our product we are in the lucky position that we have an answer for everybody. Sure. And you can use it in different markets. But I think if you compare the overall market, here you have technological investments in a density that you will not find in Asia and many places. At least I don't know any. They have different approaches, which makes Asia attractive as well with traditional medicine, but you find these offers here as well. But for sure, nobody will come for traditional Chinese medicine from China here to get a traditional Chinese medical treatment. No, he will come here because he has the most advanced technology in diagnostics and the super surgery robot. That is then the point. So I don't see there a direct competition.
Right.
All the other way around.
Those coming here electively are coming for quality of care, state-of-the-art facilities, and they've probably reached to the providers and already received some package deal for being a cash patient, because that's how they're going to be assessed. So I think with all those factors, that's what makes it even more attractive.
Got it. Okay. Thank you. Thanks.
Thank you.
Last question.
Yeah, I think this might be the last question.
Yeah,
The clock is
just
ticking.
make it the fast one. Hi, I'm Dr. Kenny from Malaysia. So I'll just like to ask a very simple question regarding information symmetry. So since Dubai placed itself at the top notch of medical tourism, one of the important information regarding informed informations and penetration of markets are actually informations. So whether or not do Dubai government actually have a registry that is accessible by public, meaning that you have a healthcare provider profiling or professional profiling. For example, that doctors conducted how many surgeries, successful surgeries, which are the surgeries that they are competent enough, being accredited and privileged to be able to allowed by the government for the quality control purpose to access or to provide the service for foreigners or the local people. Because this kind of information will allow community outside the local environment to be able to access and compare, to do an evaluation on whether or not they want to choose Dubai as a healthcare medical tourism destination.
I think, correct me if I'm wrong, but every provider publishes their panel of doctors on their website, right? I mean, it's done with all their accreditations, everything. I mean, you can find a full profile of a doctor on each provider's respective website. So it's not private information. Correct me if I'm wrong.
That's correct. And specifically for medical tourism, the DHA will only allow providers and their physicians to go onto this portal if they've been vetted by their stringent guidelines that I mentioned earlier. So it is available publicly.
You have a DHA license,
Yeah,
I mean, at the end of
DHA
the day, right?
license. Yes, yes. Okay, I think we can.
Thank you.
I believe we're done, but that was a fantastic panel.
Thank
Great
you.
discussion.
We worked hard.
Thank you very much. Let's give them a
Thanks,
warm hand
Lokia.
of applause. On Dubai being a medical tourism destination.
Thank you.
Thank you. All right. Let us call upon our next speaker, who will be talking to us about medical disasters. The MENA region witnesses approximately 300,000 stroke-related deaths a year. So it is quite an alarming statistic. So let us address the issue with Mr. Ali Tinazli, CEO of Lifespin, who will enlighten us on the topic, the silent epidemic of stroke in the MENA region. Mr. Ali.
Okay.
And let's set the timer, please. Thank you.
Good afternoon. Thank you for having me here. So my background actually is PhD biophysics and consumer tech. So I started new businesses at Sony and HP, and I think that technology can help. So I'll be speaking about the silent epidemic of stroke, but then also what can we do about it, what can technology do about it to improve the situation. So the remote doesn't work yet. Here we go. So the issue about stroke is when you have a stroke or one of your loved ones, you don't really see it as obvious. Like when my father got his first stroke, it was a surprise, and then it always takes a bit of time to really figure out what a stroke is when someone has a stroke. So to discriminate stroke against other conditions is important. What is stroke? Stroke basically happens when you have issues with the blood supply in your brain. So basically this prevents brain tissue from getting sufficient oxygen and nutrients. There are different types of stroke, obviously, which is not relevant in this specific context, but just for awareness creation. So now we understand what stroke is. It comes typically out of the blue when you don't expect it, and it's hard to recognize that someone, for the non-professional, that someone has really stroke. Why is it called silent epidemic? Now, it's called silent epidemic because it happens when you don't expect it. So there's a lack of awareness. And that's something we have to build on, also understanding what causes stroke. And the reasons are that the diagnosis is difficult. Sometimes it's even hard to differentiate that someone has a stroke or it's just a migraine. Or what's also quite kind of a disaster is when female patients have a stroke and the physician thinks it's just a migraine. Not just, but it's a migraine, and that's a big issue, obviously. So basically, the delay in diagnosis leads to more severe consequences. What can we do against stroke? So basically there is some genetic predisposition, obviously. There are some lifestyle-related aspects. Now smoking is a classic, right? But obesity, all the many things we don't really realize, basically what type of sugars do we have intake, stress, exercise. So basically what we are talking about is a public health crisis. We basically need to look at it on a population level. Only then we can have an impact. How can we do that? We can raise awareness. We can basically look at how to improve healthcare infrastructures, promote healthier lifestyles, and all this together basically implement better stroke prevention. So as mentioned in the introduction, there's a huge issue of stroke in the MENA region. So there's a worldwide growth of, or let's say increasing rate of stroke, but especially in the MENA region, it's a big issue. But unfortunately, it's not limited to stroke only. Also, other non-communicable diseases, NCDs, are going up. And so basically, that's something we have to address. And we can address stroke and other non-communicable diseases, the avoidance, but also the management of the diseases by using solutions from data science, using digital health-based solutions. That's an article which I've authored in the Forbes Tech Council a few months ago because it's an urgent topic. Now, let's talk about technology, how to solve it. The good news is we are in the age of technology convergence. That means many different technology disciplines are coming all together. Basically, we have the combination of electronics, data science, we have microtechnologies available. This all can now be mastered together to basically define better solutions. And obviously AI has a strong impact. Many different use cases which would have not been addressable 10 or 20 years ago become now real. Most importantly, it becomes also affordable. I will speak to that later. Let's speak about, let's say, definitions. People in industry, they like to speak about Industry 4.0. We all use some sort of IoT devices, I guess, right? Basically, there's an interesting combination or immersion of cyber-physical system. 3D print is a nice example. You create a design electronically, you can print it, then you can suddenly print your digital idea. So there's a blend between the physical and the digital world. This also applies to healthcare. So what we do basically is, in Health 4.0, we converge biology and data. When we look into the history of health, it started basically a few thousand years ago. Ancient times, healthcare was more of an art. It was very exclusive. Sometimes it worked, right? And it was highly personalized. Then, during the Renaissance, over the past few hundred years, medicine became more of a scientific discipline, right? Not just an art anymore, but the access was limited. What we then had, starting from end of World War II, was basically Health 3.0. What we got since the 1950s, I would say, was an amazing standardization, which was driven by industrialization of healthcare solutions. It became highly complex. With that, it became also very expensive. So I lived in the US 13 years, and the healthcare expense in the US are just mind-blowing, about 20% of GDP, not good. And healthcare access is a benefit, which somehow appears to be counterintuitive. Everyone should have access to a basic level of healthcare. Now comes what we call Health 4.0, which is driven by data science and basically the decentralization. The data science aspect makes it first very personal, because I can analyze now many, many data points. Second, at least as important as that, or even more important, it becomes affordable, because it's more cost effective. For different reasons I will show briefly. Access can be democratized, because when I have health testing solutions which are enabled by software algorithms, I can make these algorithms available over cloud solutions. Now the key trend, just to summarize, the key trend shaping healthcare: convergence of technology, electronics, microtechnologies, and data science are merging together. We are all more informed, better informed, right? Especially since the pandemic, we have even a higher awareness of medical information. Changes on the regulatory side are also moving. Now having an AI tool as a diagnostic is nothing unheard of. It's in the works. And the digital revolution aspect, data science, it's all, and we all talk about generative AI, big topic, right? I think it's all coming together. Now, what we do specifically in order to enable this is we turn analog blood into digital. Why did I choose this title? Because it's somehow intuitive. We all know how blood is. It's somehow wet and sticky, right? Then we turn this into a not wet, not sticky digital version. What I mean by that, we capture the metabolic part of the blood sample. And we use this actually for precision medicine. We basically capture or create a digital twin of the human metabolism. What is the metabolism? When we eat, we digest, things are turned into energy, and then all the different steps we have, thinking, growing, sleeping, these are all metabolic processes. When we are happy, that's a metabolic process. When we eat too much, that's also a metabolic process, right? So basically, the sum of these processes, or the compounds, are called the metabolome. It's the sum of the metabolic compounds in our body. How do we do that? And first of all, why? I think in the past 20 years, we had a tremendous success of the genomic revolution. Since the first human genome got sequenced about 23, 24 years ago, we got now, to some extent, genomics as standard of care in today's healthcare. Now, genomics shows you the potential that someone may become may develop a certain condition. Genomics doesn't tell you that you have today, let's say, Parkinson's. That's something genomics cannot tell you. Same, genomics cannot tell you if you have stroke. Genomics can tell you some sort of prerequisition that you may have some sort of, let's say, predisposition to develop stroke, but it doesn't tell you if you have stroke or not. The complementary modality of genomics is metabolomics. Basically, the real-time phenotype of your today. So the metabolome mirrors the actual real-time metabolic state, and this gives you now opportunities, insights into disease stage. It gives you insights into if treatments are working or not. And there are also some aspects about wellness or lifestyle, which I typically place at the end because that's a tough market to get in. The traditional diagnostics, I think, is well described. At the end of the day, it's about understanding the human physiology as is, but that's, I would say, something which will come in future. But ultimately, we speak about a new approach to really decipher illness and to improve treatment. In today's diagnostics, what do? Let's say when we go to a physician, the physician suspects a certain condition, you get a test for 2 or 3 different biomarkers. It's like looking at a forest from the side and you just look at a couple of trees, but you don't see the entire forest. So what about if you would have the ability to look at the entire forest, you see what type of trees, how many trees there are in the forest? That would be amazing, isn't it? So if you do that in healthcare, basically take a blood sample and scan it, capture it, basically look at the metabolites which are present in one measurement. That would be quite interesting, isn't it? Now let's watch a movie about that.
LifeSpin only needs 0.5 milliliters of blood and takes only 1 measurement for all tests. The NMR instrument is the interface between the physical and digital world. The patient's metabolic information is being captured in one single scan with radio frequencies and compared to billions of data points from individual metabolic profiles within moments. The sample partitioning for accessing biomarkers and performing health tests is based solely on algorithms. LifeSpin. Take your health in your hands.
So what we have seen is real, so you can visit us in our company headquarters in Regensburg, southern Germany, get your blood drawn. walk with us to the lab. You don't see anyone in the lab. We typically don't have much going on in the lab because it's fully automated. And what exactly do we do? So in the legacy lab testing, you get 5 to 10 milliliters of patient blood. The patient blood is being processed, partitioned. It takes time. It needs a very skilled workforce to handle it. And at the end, you get 20 or perhaps 30 different metabolites. Time intense, there's some error rate, and it's somewhat costly, right? It doesn't feel right. What we do is a different physical approach. So it may sound, for some of you, too good to be true, but what we do is we do not use any optical fluorescence labels or what. So what we do is we take a blood sample, plasma serum, we add a phosphate buffer, very straightforward, very basic, and then we insert it into a nuclear magnetic resonance instrument. You all may be familiar with MRT, imaging body parts. It's the very same physics, just a much stronger magnet than that. And then you basically scan the blood sample with radio frequencies, and then you get basically hundreds of metabolites quantitatively captured simultaneously. It takes a couple of minutes. It's based on standard procedure, standard workflow. So basically, you can purchase this instrument. It's a third-party instrument, not related to us. You can collect your own patient blood samples. What you then get is an illegible output, which is interesting for us because this is where our proprietary assets are kicking in. We have developed software which can basically deconvolute, extract the complex information, and turn it into a list of quantitative metabolites to create your digital metabolic profile. So basically, you can use it for different use cases. It's always the same workflow. You can use it to determine the healthy baseline. We have, for example, we have digitized 90,000 healthy individuals, men and women, from age 18 to 70 plus. First of all, to determine what is healthy. How does the metabolic baseline for health looks like? Then we have captured in total about 200,000 patient samples across 300 different indications to use it for general health screening algorithm, to basically use self-organizing maps to understand and to show basically what are non-healthy conditions. And right now we are developing algorithms to recognize prostate cancer. We are in the process of starting prospective study, and we have lots of activities in neurology. And just to show you a general overview, we can also see basically how people age over time. That's a publication in progress. Now, first of all, going back to stroke, this was just a tech excursion to explain to you how we are doing it. Now let's speak again about specific diseases and stroke. What you see here is a view which we call Health Compass. You can basically see instantly if someone is healthy or not. Healthy looks overall green, right? That's pretty straightforward. And if someone is not overall healthy, then we see quite interesting signals, which are all quantitative deviations from the healthy range. That means we can see things like kidney failure, like obesity, or also stroke. What exactly do we see? So we see basically a change, significant change of metabolite concentration. So this is not an esoteric pattern. You can always go back to the raw measurement data and look it up quantitatively what exactly had been measured. So it's not voodoo, it's just basic measurement science. But obviously catalyzed by AI to deal with the plethora of data. When you have stroke, I mentioned earlier that sometimes a migraine is being misdiagnosed, or that a stroke is being misdiagnosed as a migraine, very big issue. And here we are developing algorithms. That's a partnership among other hospitals, also the Charité Hospital in Berlin, where we are basically discriminating different disease states. On one hand, to discriminate healthy individuals versus patients with stroke has an AUC value of 0.98. That means the closer to 1, the more certain it is. Looks really good. So it's somewhat straightforward to discriminate people with stroke and not stroke, and being healthy. But then when you look at a migraine versus stroke, also quite interesting, we can discriminate this to some extent. This is obviously work in progress, but these are tools to basically assess if a patient had stroke, migraine, or perhaps another neurological condition. What exactly do we see? Your eyes are perfectly fine. I did blur this for IP reasons. So what we basically see are basically metabolites which show deviations compared to the healthy range. what's interesting is we see strong deviations in amino acids. Amino acids are being used as an indicator for general well-being. When you can look up, there are interesting studies about long COVID patients, for example, from 2020, where it has been shown that the degree of recovery from long COVID correlates to the recovery of normal healthy amino acid levels, which is very interesting. So basically, we see in different diseases different changes of different amino acids. That's why we decided to first launch an amino acid panel, which basically tells you the quantitative difference if you have a deficiency or excess, which can give you different insights. Obviously, it can give you insights about stroke or other NCDs. So basically, it's a panel of 26 different amino acids, and we launched this last month, actually, and the workflow is always the same because most of the work is happening in silico. Now, what we basically do is, on one end, I've invited you to Germany, basically. We do these testing in-house, but we can basically also scale this globally with local partners who have these instruments and can basically use our software to perform this type of diagnosis. That means it will be operated as a software as a service. Now, what's important is to understand what exactly we are doing, because in the conventional diagnostics, you have the workflow, patient goes to the provider, provides a blood sample, the blood is getting analyzed for one or the other condition, then you get the result, yes, no, end of the story. This is where our story begins, because what we can do is we can now, because the metabolic profile is digitally already available, now we can unlock additional algorithms, which are additional monetization events, basically, to look at liver condition, for example, kidney condition, lipid panel, or other conditions. So basically, we can have some sort of an inner purchase model for patients and providers. We work with many different hospitals, but I did explain this to you to show the potential of using software, scalable software, as a diagnostic solution on a population level. Now let's go to the global challenges in healthcare, which is related to populations. So we have megatrends, worldwide megatrends, which is on one hand aging demographics, which leads also to the increase of stroke, cardiovascular and neurological diseases. So there's an increased demand for NCD diagnostics globally. At the same time, the rise in healthcare expenditure GDP is a nightmare. Some people may like it because of market growth, but that's short-sighted because at the end of the day, someone has to pay, and that's typically us, so the taxpayer, right? So basically, how can we balance the high cost of diagnosis against accessibility and health equity? That's the key question. Now, I've shown you now what kind of technology solution we have to tackle basically diagnostics on a population level, health management. Now my question is to you, how much do you think does it cost to screen with our technology 1 million people per year? So I'd like to hear some numbers from the audience. Just shout it out. How much would it cost to use this technology, which I've shown you, to test 1 million people basically per year for different types of conditions as shown? Or even the general condition, is someone healthy or not, or has some sort of an NCD? Any numbers, any ideas? Now I can say it's single digit in this range, okay, so it's really low. Which, say again? Yeah, that's about right. And that's interesting. Why is that? And why do I speak about cost? Because I want that precision medicine becomes affordable and scalable across populations. What I don't want to have is a precision medicine tool which you can only access at Stanford Hospital or Mass General. This doesn't help, right? And that's why the question is, how can we bring this to attention, that primary care providers are enabled to prescribe these type of testing, or that you can even think of government-level programs or corporate health programs. That's why it's really important, I think, to be open about the cost, Because if you can reach everyone, even at low cost, it can be highly interesting as a business. That's also my consumer technology thinking. What we ultimately want to have is to implement AI for affordable healthcare. Because the healthcare system as it is in a huge crisis. It's horrible. AI could help to do a better job here. There's actually a study from the Harvard T.H. School for Public Health. Actually, it's a pretty new study from this year, that AI could improve health outcomes and reduce treatment cost by 50%. That's a lot, right? And just if you improve diagnostics, access to care, and enabling precision medicine. Just to show you again what we have, what we do, we basically digitize blood. We need up to 10 times less sample than the standard of care. It's much less expensive than standard of care. It's faster. When you visit us in our lab, you get your blood drawn. You can watch how your blood is being scanned. Takes a couple of minutes. Then you can watch how it's being processed, and you get your result printed out in a couple of minutes after that. It gives you much more data. And our interest is basically to scale with partners globally. Because when we have the like-minded partners, which are early adopters, obviously, then this can be extremely exciting. And one of our board members is a Nobel laureate. He also confirms or supports our thesis that almost all diseases are linked to the metabolism. It means when we have a window which is looking into the metabolism, then we have a window which looks into the health condition of an individual, and this is highly scalable. Thank you very much. Otherwise, it's easy to find me.
Thank you, Ali.
Thank you.
Thank you very much. Thank you, Mr. Ali Tanzali of Lifespin. Yes. Oh, who's not here? All of them are not here? Oh, okay. All right. I believe we are waiting for some of the panelists. Next panelists, are you here? Yes, one? Do you see your colleagues? Your fellow panelists? Dr. Gudana, Andrew, Kevin, Dr. Mohita. All right. Can we get one more chair up here, please, in the meantime? Here three? Then we will start. All right, ladies and gentlemen, masculinity evolved, navigating the path to mental well-being and authentic expression of masculinity. Now, this should be interesting. In a world where societal expectations often limit the emotional expression of men, our upcoming panelists will challenge the norms and explore the transformative power of embracing authentic masculinity. So let us welcome on stage the moderator for this panel. You said three are here? Okay, so one is not here. Okay, perfect. Dr. Mohita Srivastava, founder and CEO of Cognitome Program for Cognitome. Welcome, doctor. Come on up. Dr. Med Otilia Gudana, behavioral analyst PhD, psychosomatic medicine, forensic psychiatrist. Welcome. Andrew Wardley, medical director, CEO for Outreach Research. And Kevin Miller, CEO of Revive. He could not join. Ah, fantastic. I don't have his full name. Would you be able to present him then? Okay.
Yeah. Good afternoon, everyone. I would like to welcome you all for this panel discussion on the topic Masculinity Evolved. One of our panelists, Mr. Kevin Miller, is unfortunately not here to join us today. So Mr. Amir Safdar, Associate Head Pharmacist, UK. He's joining us in his place. So I welcome you all for this panel discussion, and let's start.
Perfect. Thank you very much. And thank you, Doctor, for taking his space. Let's set the timer, please. Thank you.
Am I audible? Yeah. Is Dr. Andrew here? He's also, I met him in the morning. He's also one of the panelists. It's okay. It's okay. Okay, let's begin. Good afternoon, everyone. I would like to welcome you all here for this panel discussion on a topic which is both timely and significant in this modern era, that is masculinity evolved, navigating path to the mental well-being and authentic expression. It is very essential to acknowledge here that this discussion does not encourage any kind of gender discrimination. Rather, it fosters the empathy, open communication for the overall mental well-being of men. And by way of introduction, I'm Dr. Mohita Srivastav. I'm a neuroscientist by profession. And I'm also the founder of the Cognitome program, which is meant for cognitive functions and cognitive skills training. And I would like to welcome my esteemed panelists, Dr. Rotilia and Mr. Amir Safdar, and I would ask them to introduce themselves and their area of expertise.
Hi there, I'm Otilia Gudana. I am a doctor in psychosomatic medicine, currently working in the field of forensic psychiatric, and I'm focused on bringing emotional intelligence in the therapeutic field. And also my main motivation is to reduce the physical aggression rates on a global level with the help of emotional intelligence.
Thank you, everybody. My name is Amir Safdar. I'm a pharmacist of 28 years. I'm the last minute addition to this talk, and I'm a man. So we will talk about man, just me.
Okay, so my first question to Mr. Amir and Dr. Rotilia is that what do you think, what are the limitations that as a man you feel that poses hindrance in seeking the mental health support?
I think you should
start. So one of the biggest things, I'm a sufferer of mental health. I've been having issues in terms of stress and anxiety since 2021, and I'm on medication for that. This is really hard for me to talk about myself, but I will. So as a man, we often we don't consider mental health as a condition. We hide it, typically. We ignore it. We put it over there and say, it's over there. It's not happening to me. I did that myself, went through trauma for different reasons, and didn't seek help when I should have got help. And it wasn't too late, because you can never be too late, but I was suffering for more time than I could have suffered if I didn't think mental health to me was a taboo at the time. I can't go to my parents and say, Dad, I'm suffering from mental health, because my dad, as a South Asian man, wouldn't acknowledge what was really going on.
Dr. Otilia, would you like to speak?
So I think there are many limitations regarding these issues of health, mental health of men. I think the first important difference is quite basic actually. It's anatomically. Men are built differently. They are genetically predisposed also differently. They are the providers and the protectors. The women are the nurturers, and they bring this emotional side to the equation. Definitely, you heard that quote, it's a man's word. It's also a song. But it's not just a man's word, but also the woman's word. We cannot disrupt or break down these gender roles if we can't see humans as one. So of course, genders play an important role in our lives and breaking down these aspects, but we are made of the same characters. The one limitation you also said is a stigma, it's a taboo which there is. I work, as I said, in a very aggressive and male-dominated field, and I ask my co-workers, who are mostly men, and I ask, how do you deal with mental health? And they said, what's that? We cannot do that. We just do. So they are programmed before birth, as I said, also genetically, to have these issues. So I think there's also a stigma part, which is also a limiting factor. Yeah.
And I would like to add here that apart from the stigma, there is a societal expectations as well as a concept of traditional masculinity. The societal expectations are, as Dr. Otelia has rightly mentioned, you need to be strong, the breadwinner of the family. A man is usually seen as the breadwinner of the family. The part of the emotion, being him emotionally vulnerable is not acceptable in the society. And the concept of traditional masculinity, as it has been defined in the literature, is basically consists of 3 traits, which are the power, hunger, and no femininity or domesticity, and being self-reliant. So these, the societal expectations as well as the concept of traditional masculinity, I think these concepts are the biggest limitations that imposes a challenge or stops a man to seek the mental health support. Right? Yeah. Also, if you can shed some light on what one can do to challenge the status quo for the concept of traditional masculinity, Amir? How do we challenge the status quo?
So the thing about challenging is it's not so much challenging. It's making people more aware of these things. Because we all have different thresholds in terms of our mental health. We'll also have times when we're not very not well mentally, and then there's times when we're really well mentally. And the challenge for us is to make sure that our performance doesn't drop, our responsibilities within the family, within your workplace don't drop, and we are strong, or we see ourselves as strong, and I will talk about what we mean by strong later. So it's a different, as you said, we're wired differently. So because we're wired differently, we have different responsibilities. We've grown up in a different way. Because I'm the oldest in my family, I have responsibilities. And the woman will have different challenges, different expectations, but the man is, as you said, the one who brings the money, the one who does the work, typically, and the one who is the ultimate carer of the wife and the children and the family.
Dr. Otelia, what do you think? How can we challenge this concept of traditional masculinity? How can we change the concept?
I'm quite skeptical. I'm not sure that we can do something to it. Like the stepping stone of the psychotherapy is the motivation to do it, actually.
That's correct.
And if the men don't want to get help, it's quite difficult to force that on him, and it won't help. It won't work, actually. So I think it's important to educate. The psychoeducation is very important, and also emotionally support the men as a woman, as we as women. But I think it's quite difficult to say, hey, you need therapy, go to therapy. So you cannot force that on something, and it won't work.
That's true, and I personally believe it's just not about men, it's about an individual in general. If the person is not motivated enough to seek any mental health support or seek psychotherapy or psychoeducation, it is not going to work. But I personally believe that educating them and creating awareness about the mental health issues, about the psychosomatic issues that they encounter with, if not expressing their emotions, the suppressed emotions in an authentic way, it is going to not only overburden them psychologically but also physically, right? So we need to really educate the men in terms of creating, awareness, and we can have many awareness sessions, talks, workshops, and support groups, exclusively meant for the men's mental health support, and encourage them to take part and be open to communicate, right?
What do you believe?
Yeah, so what I was going to say is that the way I perceived my mental health, and I still perceive it in some respects, is that we're climbing a mountain. You can do all the courses you like. It will go in that ear, out that ear, because we won't be processing it. I'm just scared of that mountain. When I first realized, I was speaking to one of my friends, and he said, Amir, you need to see somebody. You're really struggling. I didn't. I ignored it. I thought, I'm a man, I can get through this. And then the mountain, I was climbing up the mountain, metaphorically. I got up to the point of up on the mountain, and I looked down and I was really scared of a drop. Because, in my profession in the UK, I'm very well known as a pharmacist and other things. And there's shame of me not being able to climb the mountain. And it's just too difficult for me. That then opened up my emotions, and I cried. And I remember crying to my trainees who were early 20s. I'm 51 now. And I was embarrassed. I cried like a baby, twice. And they were very helpful, the trainees. It was their first day at work, so they didn't even know me. But the lesson that I learned from that is you've got to break down that mountain into small steps, and then take it step at a time, and not to beat yourself up if you've gone back. Go back up again. But that's not easy. Very difficult.
May I interrupt? Thank you for saying that shame is so important in mental health. It's playing an important role, and also it's quite a problem in seeking help. There's still a lot of stigma, and it's considered a taboo, and especially for men, I believe.
I mean, with my therapy, I had counseling, I had psychodynamic psychotherapy, I was on medication, and I did that for about 18 months. And then in the end, by 2022, I'd said that, look, I think I'm ready now to come off work and go back into work. So I was off sick for 6 months and didn't work. And that shame, where I'm at home when I should be going out for work, was debilitating. It was really hard. Even though in the NHS in England, you get 6 months full pay. So I was getting my money, but the shame of me being not going to work was significant.
Amit, do you think that being into a high leadership position also is a factor that imposes limitation to seek mental health support?
Yeah, I think the thing was that because when I opened up and put it out there on LinkedIn or Twitter or whatever it was, I was expecting a negative reaction, but actually it was the other way around. Lots of people came up to me and said, "Are you okay? Are you okay? What can we do for you? How can we help you?" And that then gave me some confidence in terms of I am good. I can do these things. I've just lost the will to do those things because of my mental health. I'm too scared to take that step. So taking that first step was, as I said, it was hard already. But when you see your friends, when you see the messages you get, and you've opened up and they say you're courageous, I didn't think I was courageous, I was still scared. But I took that first step, found out that actually there's no people are supporting me, and that for me the stigma went. It took a bit of time, but the stigma went away because that's normal now. So now I talk to people, young people who have trauma, these sorts of things. I'm not trained for this, but I always say to them, you know, take your time, I'm here, don't, you know, if you fall over, pick yourself up, you know, those sorts of things, to support them.
Mm-hmm. Dr. Rutelia, what do you think? Are there some repercussions or cost that one might face if does not seek the mental health support? Being a psychiatrist, I'm asking you this question.
I believe everything comes from childhood. So, of course, it's important to weigh in that factor from the childhood on when the parents observe some problems. Intergenerational studies have shown that not dealing with these emotions can develop a heightened aggressivity rates and aggression, which is already a complete manifestation, I would say, of these problems. This is just one part, and it's not affecting only men.
It is affecting the whole family.
Definitely is breaking up relations as well.
Yeah.
And also can just break lives.
Yeah, that's true. That's true.
Leading to suicide.
Suicidal tendencies.
Yeah, definitely.
Aggression, you know, behavioral
This is only one extreme of it.
Yeah.
But of course there are lighter sides to provide.
Yeah, so what what we're going to have in the next few years is a tsunami of mental health across the world, I think. I used to be a trustee for a school in England, and we found lots and lots of students during the pandemic years who they didn't have their friends, they were working from home, they didn't have that socialization, and we realized that they are traumatized at the age of sort of 10, 11, they're traumatized. These people, if they don't get that support and intervention, these people will carry that trauma with them. And it's every school child probably in the world, because I think in the pandemic years, nobody went to school. They didn't form relationships with their friends because their friends were all online. It's not the same. They're not playing in the playground. So we have to be very careful in terms of how we manage that. It's going to be a decade or more, I think, for to us to steady the ship and cover people. Certainly in my country, in England, the National Health Service cannot cope with a tsunami of mental health. We just don't have the infrastructure to do that.
I have personally seen in the clinical part of my work a tendency and higher cases, and the severity of cases has been post-pandemically shown. So there are repercussions. As you said, it's like trauma, substance abuse, social isolation.
Yeah.
Aggression comes.
Definitely, it's a very complex factor, which are definitely interconnected as well. Yeah.
So, as there are repercussions of not seeking the mental health support, so are the benefits of seeking the mental health support. I'm just going to shed a light on this a bit. So, what are the authentic ways a man can express his emotions, his suppressed emotions, apart from dwelling into the habit of substance abuse or alcoholism or aggression or irritability. So one way is to vent out the emotions in a cathartic way. Catharsis is a process of a powerful emotional release that, if successful, leads to very positive cognitive insights and positive experiences in life. How can, when we vent out our emotion cathartically? We can learn music, we can learn some new sports, we can retrain our brain by improvising our cognitive functions, cognitive control, mental flexibility, as well as, mindfulness-based practices, like various sort of meditations are there, brainwave entrainment processes are there. You can learn to balance your hemispheric, lateralization, and you can learn to play an instrument. One can learn to learn a new sports, cooking, anything that is creative, that enhances or nurtures your creative intelligence as well as emotional intelligence. So this is one way, catharsis. Second way is definitely to seek guidance and counseling support, or seek the psychotherapy. Basically, there are multiple ways to seek the psychotherapies, psychoanalytic therapies, there are cognitive CBTs, there are cognitive behavioral therapies, there are REBTs there. So EMDR is there. There's so many things that one can go through and seek the support to release the suppressed emotions in a therapeutic manner. So in any case, it is essential to release or vent out your pent-up emotions, which are not only creating a havoc in your psychological health, behavioral issues, but also creating long-term psychosomatic issues, which are manifested later in life as arthritis, chronic pain, psychosomatic illnesses, terminal illnesses, which might turn into cancer, all those things. So I really recommend everyone that be open, be communicative, and understand, foster empathy, enrich your emotional intelligence, and seek mental health support, not only for your own mental well-being, but for your family, for your kids, for your profession, for your work, and for your overall well-being.
See, what you've said has scared me, because you've given me a list of things that I should be responsible for. And if I was still in my mental health place, I would be terrified. And I wouldn't take the first step. I'm being honest here. I wouldn't take the first step because it's too frightening. Because you've just given me a mountain to climb again. And that's the thing.
It was quite overwhelming to hear this list, but I think it's you can see it as a list of skill sets which can help you. I think this is a multidisciplinary approach,
yeah.
And you can seek out which is helpful for you or for anyone else. It's not like it's a to-do list. One should work on, just really seek out what's helping. For my personal experience, meditation helps me, sport helps me. Maybe doing some creative work won't help me.
Creating art.
That's not me, Everybody should just seek.
Yeah,
that's benefiting.
That's a way to vent out cathartically, and the other way is to seek the psychotherapy, as I mentioned. The talk therapy, the counseling and guidance sessions. So, see, as both of you have rightly mentioned here, that not necessary that every approach or everything works for you. As like meditation, for example, meditation. We are into a lot of mindfulness-based practices here nowadays. That everybody is going to be, everybody is saying go and do some meditation, breathing exercises and all that stuff. That's fine to an extent. But, as a neuroscientist, I would like to tell one very important thing here, that we all are aware by the concept of the brain waves. So a person who is over anxious or suffering from any kind of anxiety disorder, meditation works wonders. But a person who is already depressed, or a patient of MDD, major depressive disorder, meditation really doesn't help much. Right? Because there is an alteration of the imbalance of the brain waves. So we need to balance that. So as Dr. Otelia, as a psychiatrist, she rightly mentioned that every therapy or every approach is not suitable for everyone. But still we encourage everybody to at least talk to the relevant people to whom they trust, just not suppress their emotions.
I agree. I would add, of course, medication is one aspect to it. It also, on this list, we can grab and hold on to when we seek help. Medication, it's working when someone is having acute phases or just don't want to deal right now with maybe the therapeutic process, which they mentioned already. It's not a quick fix. You really have to do the work. You really have to work on that. So medication and complementary, then adding another aspects or layers of therapy, whatever that may be.
Yeah.
I think it's helpful.
Yeah, it's helpful. And so let's discuss some more approaches that helps in navigating the path to mental well-being for in a masculine context now. Right? I think I would like to add here about the self-reflection, you know, the self-awareness. One should reflect their own emotions, feelings, and thoughts periodically and understand what is wrong. Why am I being so irritable these days? What is that is bothering me? You know, if you are self-aware, you're self-reflecting, that would definitely triggers, and if you understand your needs, that what are the trigger factors, that is why it is happening to me nowadays. I was not like this before, you know. So that self-reflection is very important point from a man's perspective. And second point I would really like to emphasize here is about being open to communication in a very honest manner, and of course with the right person, not to everyone that I'm having this, I'm having that. So better to go to a professional or look for in the internet. There are many support groups you can join, you can share your stories, or you can read some articles that why is it happening, educate your own self. Be open to communication. Creative writing is one of the things which helps. You can share your story on the social media these days, you know, you can share whatever you're going through. Join the support group, seek the psychotherapy. This will also help. And third most important point is how to navigate this path of mental well-being is, you know, you can really go for the relaxation techniques. Like, as I mentioned, there are meditation-based practices, and there are some kind of, you know, creative tools and techniques that helps to foster the creative intelligence, and also go for the emotional intelligence classes. You know, that also help to understand your imbalance of emotions in you and how to express them in a genuine, open manner. So I really would encourage you to be open to communication and seek support, because it is not going to help only you, but it is definitely going to help your family and your you know, colleagues and friends and family. Amir, would you like to add on to this?
No, I think that's really good advice. And it's again like that, taking a horse to water and get the horse to drink the water. I think it's a great, but it's still, if you're terrified, you're still terrified. The stigma of taking medication for some people, and I'm a pharmacist, I shouldn't see taking medications as a stigma. That's my professional life for 28 years, but I did when I first took my citalopram, you know, and then it was quite funny, which broke the cycle. Was that my brother's on say medication, and he got constipation. So he was telling me that when you take this medication for the first few weeks, you might get lots of constipation. I didn't get constipation, I got diarrhea. And it was one of those diarrheas when you only have like 30 seconds to get to the toilet type diarrhea. And then that made me think that different people react differently to the medication, and it takes a bit of time for it to work. You start on a slow dose and you go up. I knew all of this. Professionally, I knew all of this, obviously. But as a person, as a human, I did know about it, but it's still a stigma for me. I'm taking the tablets. Now, I take them as routine. You know, it's not stigma anymore. I just take it, that's it, job done. And I tell people that I take it because there's no stigma for me anymore.
At last, but not the least, I would also like to end this session by saying one very important point, that regular monitoring of your mental well-being by evidence-based self-assessment as recommended by a therapist on a regular basis would really help you reflect on what is going through in your mind. For example, if you're in a bout of anxiety, you're bout of overstressed or something, and that would definitely help you to seek the support on time. Okay, and I would like to welcome the questions from the audience, if anybody would, yeah, please.
Hi, I'm Dr. Trishala Chopra. So this topic was extremely important because it's not discussed. And I come from India, and India is a place where this topic is definitely not brought up because there's a lot of male ego that comes before seeking help and understanding. So being a lifestyle medicine practitioner, what I face on everyday basis is my consultation with a male is very quick as compared to doing it with a female. So men are not very open. So whatever suggestions you shared, I felt that they work as distraction for a while, but when people are actually coming back to reality, the things are just there the way it is. Yes. So I have seen my patients benefit a lot from NLP, the neuro-linguistic programming, and the hypnotherapy. So my question is that the hypnotherapist that I normally refer to says that this therapy might not be very effective for somebody who's already on benzodiazepines or SSRI. So I wanted to understand from the panelists that how effective are these therapies when somebody is already taking drug support, and I have seen a lot of side effects coming from the drugs. So the benzodiazepine itself gives you depression, it gives you anxiety. So sometimes it worsens for many people, and they're in permanent denial that there's no help available. So what is your experience been with patients who are taking the drug therapy, especially on the benzodiazepines, and how do they normally respond to these alternative methods for actually understanding what's going on with them? Thank you.
Sure, I would like to take your question, and I would like to share an experience with one of my clients who was suffering from chronic anxiety from past 20 years. And he was on a dose of SNRI, 225 mg per day. Severe anxiety patient, but what happened, the situation has started that he was an anxious individual, the medications have been prescribed to him, and since grade 10 he has been taking those medications. But when he came to me, he was really into bouts of crying. Apart from anxiety, the depression has stepped in to him. So, of course, the counseling sessions helped and all those things have helped, but there was a structured protocol which involved all the kind of holistic training, including the cognitive functions. So what was happening, I cannot ask anybody to stop the medication without, the recommendation of the doctor or the GP he or she is going to. But I educated him. I motivated him just to try if he can reduce a dose a bit and see how it works. Or just 1 or 2 days, if you don't take a dose, what happens? What are the physiological symptoms that you are actually encountering with, right? But the point is this here, we should actually have a balance of both. We should have balance of the medication. If somebody really needs a medication, we cannot ask to stop the medication, right? But eventually the aim should be, we should be drug-free, right? So this guy eventually has reduced his dose, and in a span of 9 months, he's confident enough. His, the scale of the cognitive functions, when he joined with those drugs and everything, it was 321 out of 800. And when he left the program, in the span of 6 months, it was 671 out of 800. His dose was really reduced because he was being educated. He himself reduced it, and with the seeking of the consultation of his doctor, his psychiatrist, and it worked miraculously for him. And it's, as Dr. Rotelia rightly said, that it has to have a own motivation to succeed. These talk therapies and everything will definitely work. At least you need to initiate something. You need to tell them the sense of right or wrong. What is wrong in you and how do you need to navigate this path, right? So it works both the ways. First of all, what is required is the motivation to succeed. If somebody thinks that I want to get rid of the medicines and I want to live my life, medicine-free life, then it's his own free will and its own willingness to work in that direction. So I won't say that the drugs are definitely are really going to hamper something, but I think that there should have been a stepwise process to, and our main goal and motive should be to have a drug-free life.
Can I just come back to that? Sorry.
Sure.
It's just because I tried it. I'm a pharmacist. As a pharmacist, I would be saying to my patients, you've got to take these every single day. And what we do, and I studied this in 1999 when I did my MSc around patients' belief of medicines. So I'm an expert with a small e in terms of patients and how they take their medicines in terms of concordance and compliance and adherence. And I didn't do that. I experimented. As a pharmacist, which I should never have done, I didn't take medication for 1 day, for example, and I slept for 12 hours. And I put that down to my stress and me not taking my medication. And then I get more stressed when I don't take it. So I did go to the doctor, to the GP, and the GP said, we're going to up the dose from 20 milligrams to 30 milligrams. I'm now on 30. And they said, don't come off it until I've spoken to the doctor and we'll have a phased drop down. Because I've been on it for over 2 years now. So I can't just stop. I'm too scared to stop. Therefore, I'm addicted, if that makes sense. And that has another aspect of men's health. When you're addicted to your medication and you can't come off it because there's going to be negative things that come out of it. So it's your mind, even if you're not well enough, your mind is putting all these things into your brain and saying, actually, you know what, you can't take these medicines off because you need them. Then you become dependent. You see, so it's a really fine line. But you have to go to, I've had the conversation with the GP. I'm too scared to have the conversation with the GP to come off the medicines just yet, for a variety of different reasons. But at some point I need to stop. And I'm on this stage saying, well, I don't know what it's going to be like. And that terrifies me.
Quite a loaded question. I truly believe that regarding medicine, regarding psychotherapy or any other therapy included, there's an individual, the plan must be individualized for the patients. We cannot say everyone should take medicine or in this dose, on which dose, and after 3-6 months we should just stop the medication or even prophylactically give it to them for 2-3 years. Of course, there are guidelines and we respect them, but the main goal, and I think the main goal is that the patient is doing well and he or she is feeling good in his skin and it's not harmful to him. He's not disruptive or correct. So I think medication is one part of it, but also pro-socially adapt this patient and rehabilitate into his everyday life. It's very critical, yeah.
Any other question?
Hi, thank you. I'm Dr. David Lee. I'm a clinical psychologist, also a certified addiction recovery coach as well, based here in Dubai from the UK. First of all, I just want to say I really like the title, Masculinity Evolved, and I particularly like that you put authentic expression in there. One of the things I wanted to pick up on is a lot of what you were talking about, Amma, about your own sort of journey, and as a healthcare professional yourself, and I'm a healthcare professional who also believes in the power of speaking out authentically about a recovery journey, whatever that be from, whether it's depression, whether it's an anxiety disorder, whether it's addiction. My own journey is personal recovery from addiction and alcoholism, but I'm also a mental health professional. What I'm really interested in is how we can sort of change stigma in society. My own belief around that is that the more anti-stigma campaigns that we're having, it isn't helpful. What we need to do is create a culture of people who will talk openly and are willing to be a face and a voice for recovery. And I really want to thank you. A lot of gratitude for you doing that, yourself in your profession. I think I experienced the same sort of initial sort of reluctance to sort of speak out, and now I've found myself in a place where I'm willing to do so, and I feel the need to do so. My question really is around how do we take that further in society, and what are your thoughts around how we can start to empower men, if you like, to speak openly about their recovery and their journey, their mental health journey?
So thank you for that. I've done that. I'm on that journey in that I've written a few blogs for my profession, which are on LinkedIn. Anybody can join onto my LinkedIn. And they have picked up good traction. I've had people come, direct messaging me, and thank you for writing this blog. They've given their, and somebody who's quite high profile within my profession, if you've got this and you're struggling with it, well, that's okay for me to be struggling with it as well. It's not taboo anymore. I've spoken at a conference a few weeks back, similar to this, but I was walking around, and I've made it my mission for the next few years. I work with a charity, and I've written blogs for them, and I speak on behalf of them in terms of mental health, particularly young people, and do what I can in the time that I have to help people. And that's just my character. But that then means that we are beginning to normalize it. It's not so much of a taboo. Because if somebody with my prominence within the profession is openly talking about, like what I've done just now, that makes it easier for them. They can go to their parents and say, Mum, Dad, I'm really struggling here. And it's the taboo will then be less in terms of impact, I think. And that's what I'm trying to do as best I can. Because personal stories of individuals who sort of end up with a positive outcome is really, 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 really important, because it shows people that you can be down in the dumps and really upset, but there is a way up. Whatever technique we use, there is a way up, and you will get there, and it might take more time. You might need some help. Come to me, come to anybody else. We'll give you positive vibes. We'll have conversations. And then if I don't hear from you, that's a positive outcome. That's what I say to my people who reach out to me.
Just in a short addition, I would like to add that definitely spreading awareness is one thing, but it would be crucial to attract the authorities, companies, and organizations to take a step and really just disrupt the rules or the norms, different cultures or societies. What do I have? It's a cultural, it's a quite complex thing, I would say, and we need the help of everyone included here.
It's still seen a taboo. I left my job because my manager at the time bullied me, even though I had mental health, and even when I was going through disciplinary, I said, this is mental health, this is not capability. But then in the end I left because she wasn't listening, and I went somewhere else. And that's the taboo that we need to break, particularly within, I work in England, in the National Health Service, it's toxic. We all know it's toxic, but we need to be able to do something about it. And I'm not going to do it by myself. I've got no intention of doing that. There are other bigger people who can do these things. But writing stuff down doesn't come with action. The action has to come from the top. Thank you.
So, any other question? Yeah.
Yes, one more question.
Yes, this is Dr. Ramiz. My question is about the difference between psychologists and psychiatrists. The most common difference is giving medication. People know that, at least known to people. Psychiatrists give medications, psychologists don't. So the question is, who should go to a psychologist and who should go to a psychiatric? Second question, are they completing each other or they are competing? Does everyone try to take the market from the other profession, or let's say someone goes to a psychologist and then they find there's no way to complete the trying to correct the behavior and then gets referred to psychiatrists? So are they referring to each other in order to help the public, or they are trying to keep their markets? And again, who should go here and there if someone has a problem?
Would you like to take this question? Yeah.
Sorry, could you repeat the question? Sorry, because you said a lot. So if you could just break it up into.
If I have a problem, okay? I don't know how to diagnose the problem.
May you please speak a bit louder? Yeah.
Who should go to a psychologist and who should go to a psychiatrist?
The people with psychosis should definitely go to see a psychiatrist. But in addition, they have also the therapist as well. It's like really multidisciplinary work, but it's important to say that you have an issue or someone has an issue. If that's just the general medicine or the general doctor, it's important to say someone. But the one with psychosis, go to the psychiatrist, definitely.
Yeah, I would like to add here is that people suffering from psychotic disorders, there is a criteria defined by DSM-5, Diagnostic Statistical Manual of Diseases. So there are different kind of disorders defined. A psychologist basically does the psychotherapy. Psychotherapy includes the talk therapy. Most of them are talk therapy, guidance and counseling sessions. And there are multiple ways of doing the psychotherapy like CBT, REBT, cognitive, the emotional therapies, so many things, EMDR and all those things. So they are generally the talk therapies. They will guide you, encourage you, and show a way and vent out your suppressed emotions. But the psychiatrist, on the other hand, is a person who, he's a medical doctor who is going to give you the prescribed medication on the serious issues like bipolar, MDD, schizophrenia, you know, all those disorders which are not going to be tackled only merely by talking or seeking the psychotherapy.
So basically psychologists work on behaviors?
Sorry?
Can you say psychologists work on behaviors?
Yeah, psychologists for the behavior, your anxiety, your stress, day related to behavioral issues, or anything that is creating, trouble and giving you trouble, you're not able to think clearly. So you can go to a psychologist to seek the support, even in general ways. Need not to that you have to have some anxiety disorder defined or depression defined. In day-to-day lives also, you can go to a psychologist and seek the guidance and counseling sessions. Maybe it's family stress, maybe it's work-related stress, maybe it's just a time period that you're going through. So you need that support. But psychiatrist is definitely going to, he or she is a medical doctor and he treats the patient, the psychotic patients, the patients with the psychosis. As I mentioned, schizophrenia, bipolar disorders, serious mental health issues.
Sorry, it's very important to understand the severity of the issue. Like, just for an example, if someone is seeing dolphins in the air, that's a serious sign of psychosis, right? Then you should definitely should be seen by a psychiatrist, not only to get the medication prescribed, but also conclude some diagnosis, because also the organic medical issues can provoke these mental health issues.
Thank you.
I hope I made that clear.
Thank you very much, panelists. That was very nice, and thank you for sharing your personal experience. Amr, would you say that this new generation, Generation Z, is very much more able to communicate authentically and express themselves? The 17 to 20, I guess the oldest Gen Z right now is 24. Would you say that this generation is more open to communicating and expressing authentically their feelings? And And the masculine Gen Zs.
I'm
Male
not
Gen
so
Zs.
sure. I'm not so sure because.
Well, maybe we can open it up to the audience. The doctors, Dr. David, Dr. Lee, is it? Yes, I believe you were saying that you work here in addiction. So would you, I don't know if you work with Gen Zs, but would you say that they're more in touch with their feelings and more apt at expressing themselves? The men, the boys, the 17 to 24s.
The boys of Gen Z we're talking about here.
Yeah.
I'll give you my personal experience of that. How do we find Gen Z born, did you say 24? So you're talking about
Currently,
anybody?
the oldest Gen Z is 24, yeah, about.
The oldest Gen Z is 24.
The oldest
okay.
Gen Z. The youngest would be 14, yeah.
Okay, so I will speak here as a clinical psychologist who does work with adolescents. I don't work with young children, but I work with adolescents and I work with young adults. I'm also a father of a teenage boy as well. So my own experience of that is that, have we made progress in terms of young men, or male adolescents being able to talk openly about their feelings? My own experience of that is that, well, society's changed. We now live in a technological, digital society that's only getting progressively more. We're moving towards AI, everything. Is that going to help us to be more emotionally intelligent and articulate? I don't believe so if we just hide behind technology. I believe there's a way in, and I believe that for boys and males that has to be culture appropriate. There has to be a way in around interests, whether that is it doesn't need to be sport. I'm speaking very stereotypically here, but we have to think about the way society's progressing. Do I believe that boys and young men are all of a sudden talking openly about their feelings with each other? No, I don't believe so. But I think there is a way in, and I think, for example, there's a wave of sporting celebrities and athletes who have talked openly about their recovery, for example, from mental health problems and addictions and things like that. I think that's a way in. If boys can look up to role models who will talk openly about their suffering from depression, anxiety, addiction, trauma, whatever it is, that what we do is we create a wave there where people feel more comfortable to not be judged or stereotyped for having had those difficulties. Mm-hmm. But it has to be a cultural change. It has to be a societal thing. Yeah, you create waves. You can only create tidal waves from ripples, I believe.
Thank you. Thank you very much, panelists, for sharing your insights with us. That was thought-provoking. Thank you. Let's give them a round of applause. All right. Thank you very much. Next, we have our panel on the topic of the role of public hygiene in creating a healthy community. So we all know that good hygiene practices are fundamental to ensuring a safe environment. So let's hear from our speakers. And the moderator for this panel is Mr. Mazen Abu Shaban, consultant pediatrician, consultant pediatric nephrologist, Chief Medical Officer for the Valiant Clinic and Hospital. Welcome, Mazen. And the panelists, Turbinderjeet Dhillon, Head of Nursing Quality for Prince Sultan Military Medical City. Welcome. And Nasser Al-Kelawi, Chief Financial Officer for 3rd Health Cluster in Riyadh, Ministry of Health. Welcome. Let's set the timer, please. Thank you.
Assalamu alaikum and most welcome. I'm very happy to be one of the panelists here and to discuss this one of the most vital topics actually, which is hygiene. Because as you know, and as everybody knows, prevention is much better than cure and than treatment. And to reach to the prevention, it means we have to follow the exact rules and the exact instructions for hygiene. And I hope the three of us will be able to illustrate how important the hygiene is and how the role of hygiene in preventing diseases, in making a healthy community, and in helping each other actually to live a comfortable, healthy, free disease life. Actually, there are too many aspects in the public hygiene prevention or in the public hygiene follow-up which can lead to the perfect life and can help the finance of the health services to decrease the finance of the health services, to decrease the expenses by decreasing the number of patients entering a hospital, by decreasing the suffering of the public if they follow the proper hygiene. And we will start with, each one of us will introduce himself. Actually, it was already introduced, but please, if you can introduce yourself and start. And then Mr. Nasser as well, please.
Good afternoon, everybody. My name is Tarbinder Jed. I am actually having a nursing background. My expertise are into nursing leadership, patient safety, and patient experience. Thank you, Dr. Mazin, for actually highlighting the word prevention is better than cure, because hygiene can cause serious repercussions if we do not take care of ourselves.
Mr. Nasser.
Thank you. I'm Nasser Al-Khlawi. My initial experience probably would be differ from most of you. Besides being a number cruncher and doing all the finance and paying all the bills for the hospitals, my initial experience was on the consulting business, and then on the oil and gas, on the finance and reporting and governance. And for the last 5 years, I've been into healthcare systems in Saudi Arabia and Riyadh on the Ministry of Health, where it has been really challenging and interesting to be on that age where this whole healthcare transformation journey, corporatization journey for the whole system, and where such interesting subject has been one of the fundamentals areas to focus on and become part of the preventive curing rather than curative, and it contributes much into the value-based health care that is focusing on the outcomes rather than other elements. There are financial aspects, as Dr. Razin mentioned, around this on the optimization and efficiency of the spending. But probably I will represent an unbiased opinion because I'm not a doctor or a nurse, but still on the healthcare sector. So I will probably contribute on this subject as an individual of a community who cares about having hygiene and clean community. So we'll discuss further, inshallah. Thank you.
So we will start actually to see what are the pillars for a proper public hygiene, which can help the community in having a free disease community and which helps in living a disease-free life. We will start with the quality controller here, with our quality, because normally if you see the combination actually here, we are medical quality, where the quality, of course, so the quality reports the infection control lady and the risk and the risk officer as well, and then we will help the finance to decrease the expenses of a hospital by following the proper techniques. So please, we'll hear from you what are the pillars in your opinion, what we can follow and how we can follow the exact hygiene to be able to achieve our goal.
Thank you for this interesting question, Dr. Mazin. Actually, I would like to highlight something. Those pillars that we are mentioning, happens in our early childhood actually. It happens at home. If you have children at home, it's very important for us to educate our children on how to keep proper hygiene, how to use sanitations properly. In 2021, WHO has done the WASH programs. Unfortunately, till today, we still do not have clean water. There's about 2.2 billion people around the world still are lacking of clean water. So this is one of the great pillars to educate your children at home on how to keep hygiene. Throughout this whole processes, I think children should be also taught to educate them how to dispose of proper waste management, your sewage, waste management, keeping your environments very clean. So from there onwards, from your childhood, home, environment onwards, you step up to schools. So in schools, you have school-based interventions. That is one of the biggest pillars. I'm so sorry to say that at this moment, although we are striving to go for AI and everything, some parts of the world are still lacking school educations on public hygiene. Children are taught on dental hygienes, but children are not taught on how to do proper hand washing. Children are not given proper soap and water. Okay, they are also not taught how to do your defecation process properly. There are about 600 million people around the world who is still doing open defecation. So these are all contributing factors to me. I think further to that, maybe Dr. Mazin can add on some things to that.
Actually, I would say that from our previous experience and the previous suffering with the COVID-19, we have learned a lot. We have seen that the virus has spread from some parts of the countries more than other parts of the countries. The parts of the countries where this virus has been spreading, I'm speaking about the area here, it was the area, which is the crowded area, where the proper hygiene was not followed in these areas, and the population of this area were much more than what they should be. And these areas were the areas of the labor, the areas of the people who were working 24 hours without relaxation, without having peace of mind, without having relaxation for their body. So these people were more liable to get quickly diseases because their immune system was lower than other parts of the country and of other areas. That's why I would say that there are certain wrong concepts in hygiene. The wrong concepts are that, I mean, which have led to the pharmaceutical companies. They have gained a lot of money through these wrong concepts. Everybody has bought at home tens or hundreds of sanitizer to be put at home, but we forgot that water and soap are the best for hand hygiene and for personal hygiene. We have forgotten that taking bath a day and to take care of your personal hygiene would help the community a lot. We were using, unfortunately, and too many people were encouraging the hot dryers or the hot air dryers, which have been proven to be not the best, and which have been proven not to reach to every part of the body and not to kill all the germs which are on our hands and the areas which we are using it for. We have also reached to the fact that, I mean, the children in the school, they are not taught properly how to reach to the best hygiene. When they cough, They should be, when they start coughing, they should be taught and they should learn that coughing, you should cover your mouth, that when you cough or sneeze, you should cover your mouth. You should put your hands on, or your elbow on your nose in order not to spread the germs you have. You should use, paper towels and not use your shirt or not use any other thing to be able to get rid of it and to get rid of the germs. I would like Mr. Nasser to say, what were the expenses during this pandemic which we have passed through, and how much were the expenses of the sanitizers, of the PPTs, which we have been spent to be able to face this pandemic. We have spent a lot of money, which with the prevention alone, we could have saved a lot of it, actually. So from the financial point of view, in your opinion, what do you think, how was the load on the medical services in the institution where you were working from this huge expense to be able to face the pandemics, the viruses which were spreading, the bacteria in different phases of the year, actually? What can you tell us, please?
Okay, thank you, Dr. Mazen. I think COVID-19 has its own circumstances because it's unusual, infrequent, and there is a huge amount of cost incurred to prevent and fight the virus. And that probably can't be generalized across the years and the time because that's a special circumstances. However, I totally agree with you. There has been billions of dollars that has been spent, not only on the curing the viruses and patients on the ICUs, but also into developing those new habits on the people to prevent getting contaminated with the virus, with using all the masks, sanitizers, developing new habits of like covering the mouth while coughing, etc. That behaviors has been developed, and we believe the amount that has been spent probably is a future investment, because I'm, for myself, as an ordinary individual in the community, have gained new behaviors to maintain hygiene, and therefore I will have positive impact on the community. When I checked in the room last night in this hotel, I found next to the bed 2 bags of sanitizers. We never have been seeing this before COVID-19, but although the pandemic is shrinking, going down, and probably we are getting live with the result, but still I think those new good habits has been developed and are becoming part of the inherited behaviors of the people. And that's what we probably can capitalize on and to contribute more into the public hygiene, because the more hygienic and clean you are, the more impact you will have on the whole community. And a family is a smaller community. If you maintain those habits, those will be communicated and therefore will escalate to the whole community. Now, financially speaking, on this context, I think probably the direction needs to be into more of focusing the investment and spending on the healthcare systems, on the preventive rather than the curative, because it really matters where that return on that investments will pay off in the future. Whose responsibility is this? I think everybody's, the family, the parents, and even the system. The system needs to redefine the spending on the healthcare system and focus more into making the wellness and well-being of people before they get sick. Since they're born until they get old, most of the funds are being directed to patients when they are admitting the hospitals. And chronic disease really constitutes large amount of those expenditures. With the new concepts of the model of care that we are probably looking at in our country for now as part of the Vision 2030, to maintain the new model of care and the value-based healthcare, is to focus and redirect those funds into preventive where we can go to schools, we can go to malls, start talking to children about habits that the doctor and yourself has just mentioned. Maintaining your clean or your hands, brushing your teeth, all the kinds of habits that will contribute and so whatever we spend, and the initial investment will be probably high in the first place, but the return on that on the long run will be potential.
Yes. So what do you think about the public education in that? How can the public education plays a role in the general hygiene actually? What is the major parts? How we should proceed with the public education in the different fields, at work, in the schools, in the nurseries, at home? How can it be? And what do you suggest as a program to be done for that?
First of all, I will start with the schools. I think to enhance these hygiene programs, children in schools should have school-based interventions like create awareness first that what is your environment, where are you, how clean is your environment, get them to be attentive, pay attention to your environment, it's very important. Look around us right now, we are sitting in a clean environment. What if I take you to a beach that is dirty? Would you like to sit there? So these are the things that let them have the attention. Once they have the attention that the environment has to be clean, then you have to make sure they retain those attentions with them. The retentions are very important also because you do not want that to only happen once in a lifetime. You want this as a habit. Develop cleanliness as a habit. Once they start to develop this cleanliness as a habit, children should be motivated. Again, culture. Make it as a culture at home, culture in the school, motivate them. Teachers, parents, motivate them. Give them some reinforcement. I mean, I know many parts of the world, children are being forced or punished to wash toilets, dirty toilets. No, this shouldn't be the way. Cleanliness shouldn't be a punishment. Cleanliness should be a habit. So if we can promote all these things, awareness, attention, retention of knowledge, and also motivate and reinforce them, I think it can become a very good program for those things. And those things can also be used in workplaces, among food handlers. I can see sometimes, I mean, I've been here for 2 days and I was going with my mother to the food court. And I saw food handlers wearing gloves all the while. They are on the gloves and they're touching the food with the glove and also touching the surfaces with the glove, using the cloth to clean the environment. Now these are some things that we have to take into considerations or put into perspective because maybe they are not being taught properly. So again, very important, a very fundamental thing here is the leadership where we are working in. Workplace leadership is very important because a leader at the workplace should be first educated. And when you are educated, you can also overview your staffs. And when you overview your staff, you do not put it as a punishment. You did not do this, you did not do, no. Make it into a way that people will love to do that. I will change my glove because I need to prepare food. I'll change my glove now because I need to clean the environment, so on and so forth. And in the community, you see there's also a lot of things that we can actually enhance. Sometimes you walk around in the malls and you can walk about 100 meters, but you only find one waste paper basket or one dustbin only. And you'll be carrying your coffee cup or your tissue somewhere. And I can see sometimes, you can see tissues are being put into the seats, places, coffee cups are just kept like that and things like that. So these are all education, public education, where we can do it through internet, televisions and things like that. I hope I did answer your question.
Yes, exactly. I mean, which means that, I mean, in summary, that the public hygiene, to be able to create a healthy community, it is a chain. It is a rings of couple of people who are cooperating with each other, starting from the family, the nursery, the school, the community, the government, and each one of these, chains should play his major role to be able to reach and to achieve the target. The fighting of the mosquitoes, for example, in our community, it is not done by me or you alone. Treating the stagnant waters on the streets, the sewage on the streets, to be corrected properly, the drain of the rainwater, to avoid the stagnation of water in different places, to clean the surfaces of the public areas, of the recreation centers, of the metros, metro station. It is not done only by me, although I have to share in that by doing my part for myself. But it is also a cooperation between personnel, between the government, between the state, between the ones who are using these facilities. So it is, if we cooperate all together, I'm sure 100% that we will be able to reach to the target, and we will be able to live in a very healthy community, which is free to a major extent of diseases free, pollution free. All of these things can be with the cooperation of all of us together. We will decrease the expenses. We will decrease the number of sick patients entering the hospitals, which will be we will be again attacked from the hospitals. Why you are not sending us patients? Why the patients' number is decreasing? It is actually an equation, an equilibrium, which should be solved in a different way. But we should play our role in creating a healthy community. I hope you agree with me.
Yeah, I definitely agree with that. Behavioral, simplify it as a behavioral change. We healthcare leaders today have to bridge these gaps between parents, schools, public, to educate them on better hygiene perspectives.
Yes, Doctor. I can't agree more with you. You are the experts in this field much. But I think it's a role by the person, by the family, the system also, and probably things like preventing the pollutions, the waste disposal practices, the recycling processes. That's also another contributing factor to prevent from communicating those communicable diseases, and probably will have more. So it's more of having the quality of life as a whole result, starting from developing a personal behaviors from the persons, the contribution of the systems and the government into maintaining that system hygiene enough through those practices. Overall, will have definitely a contribution to the whole quality of life, and as a result we will have less sick people, less patient, we will spend less on curing them, therefore maximizing the value of our money and budgets to be spent on the healthcare systems to redirect it in the preventive. And that will contribute positively more in things like the chronic disease, diabetes, etc., by having those habits, increasing the age of the people. So I think there are a number of interrelated contributing on this as well. Thank you.
Let's hear the opinion of our audience. Suggestions, opinion, questions of our audience to see actually we complete each other all, and the community should be actually the contribution should be from each one. How do you think, if I will ask you the question, how do you think that how we can reach to a perfect hygienic society where we can live actually in a peaceful, disease-free, pandemics, endemics-free community and society? What do you think actually? If you have any suggestion, if you have any question, that would be great to hear and to discuss it together.
May I answer this question first, Dr.
Please, please, yeah, go on.
I came from a country called Malaysia. I envy my neighboring country, Singapore. I envy Singapore. Those Singaporeans, if you are sitting here, I envy your leadership because you have created a very good hygienic program. In Singapore, you are not allowed to eat chewing gums and things like that. Also, they have very good habits. If you eat in public, you clear up your own tray. You clear up your own spaces. They have very good water and soap sanitations, most of the places. They have very good education. They have these Clean Singapore programs going on all around the year. And I seriously envy this kind of country because it's, if anybody of you have been to Singapore, yeah, you see Singapore is very clean. I mean, to see, it's very nice. So does Malaysia. My country is also clean, okay? But there is a problem. I think many parts of the world, we have pipelines in our house, water pipelines in our house. But there are issues with these pipelines. We have very good pipes, chrome base and everything, but the water does not flow from the pipeline. Okay, some pipelines have water which are rusty. I mean, will you agree with me if you have encountered that? You have rusty water coming out, you have pipelines that does not have water, so sanitations are problematic here. So these are things that healthcare leaders today, and I do believe we have AI analysts or AI specialists that are sitting in this crowd today that will help us, healthcare professionals, nurses and doctors, to develop programs, AI-based programs for schools, workplaces, to improve and also to assist us to speak to the leaderships of some regulations. We have a lot of healthcare laws, regulations done by the UNICEF, WHOs, OSHA and things like that, but we are lacking implementations.
Yes, actually, this is the point. I mean, the DHA, in United Arab Emirates here, the health system is one of the best, actually. I mean, I'm sure you have seen, I have seen, I'm living here for the last 33 years in the United Arab Emirates in Dubai, and the way how they have faced the pandemics which came to this area and to the whole world, it was one of the best, and it was ideal actually, which should be repeated in other countries. We have protocols, we have everything actually for schools, for nurseries, for public, for everything, but the most important things how to implement and the people who obey and do it. I mean, I'm a medical director of one of the hospitals. Until now, from the health authorities, we should put masks in the hospital. Masks in the hospitals are not removed. We are putting masks in the hospital, and I'm one of the people who do not remove the mask in the hospital, and it is in my pocket actually here. And even when I go to any crowded place, I put the mask. When I pass through the corridors, I mean in my hospital, whenever they see me, they start putting the mask. Whenever I turn my head to the other side, the mask will be here on their neck, and so on. So it is not the system, it is not the protocols, it is the human being himself who should follow and who should obey and who should know the facts and the reality that these protocols have been created and have been done to be followed. These protocols have been created after long investigations and after long search with all other countries to be able to reach to the proper how it should be done. And it should be followed. They were not done, and so much money was spent just to be put in the files of each individual in the hospital. No, it was done it was created to be followed and to be done. If we follow it and if we know the rules, everything will be easy. Don't you think so, Mr. Nasser?
Yes, of course, I agree with you. Dr. Mazen, I think one important thing that we have developed 4 years ago, and since the start of the pandemic, there has been numerous number of behaviors that has been developed. I think our role as family and individuals and government systems is to maintain keeping those habits, the good habits, going forward. 4 years ago, when you go to a hair salon or a barber shop, there is a below minimum expectation of hygiene and maintaining. The tools are not sanitized, no masks, no proper, exactly. And it was very severe during the pandemic. After that, and until now, in my country, for instance, it became part of the rules imposed on all those kind of services to maintain that upskill level of being hygiene on doing that service. So our role is to keep emphasizing and making these habits becoming part of our inherited principles to us and our children, to maintain more contribution into the hygiene system. So I think this is everybody's role going forward, and inshallah we'll have that very well positive impact on the community as a whole.
Inshallah.
Thank you.
Actually, this is all what we can, present for you today from the hygienic point of view. If there are questions, we are ready to answer your questions with the pleasure.
Yeah, actually, I have a comment, not a question. Actually, we all talk about wanting to have sustainable results, right?
Could you come closer to the mic?
The community, we want the community to be committed to hygiene. We want sustainable results. Don't we need sustainable effort to maintain that result? For example, we see at the time of pandemic, we see everywhere educational signs, educational awareness programs everywhere, here and there. Right post-pandemic, all signs were gone. People used to come back to what they used to do before pandemic. Yesterday at the airport, crowd, walking among the crowd, someone sneezed on the air. I can't imagine how many bacteria are going around and how many persons caught the bacteria. Because again, we have a reactive behavior. We tend to have a reactive behavior rather than preventive behavior. In terms of finance, do we have budget for preventive practices to prevent such pandemic to happen again? Now, before you used to see signs of how to cover your sneeze. Now I didn't see that everywhere. We used to see queues and lines, organized lines. Instructions, everyone is done that by law. We tend sometimes to do something good by law. How do we make that lawful practice a culture? I think by having a sustainable education, a sustainable awareness, a sustainable effort, ongoing. Why do we have to do something once the issue is gone, then whatever effort has been withdrawn again, and we come back to the old practice? Don't you agree?
I agree with you 100%, and this is what we meant with the public education. Public education is not only for pandemics and endemics. Public education should be continuing. Posters should be put all over how to clean your hands, what you should do when you sneeze, what you should do when you cough. These should not be removed at all. The public education, whether it is in the nurseries, in the schools, at work, in the companies where you are working, in the workplace, this should not stop, whether there is an endemic, pandemic, or there is anything, because even flu by itself, even flu, which is a very simple thing which we are facing each year, and we are taking injections for it to avoid it to come. Even the flu needs the hygienic education to be able to avoid it and not to spread it. What happens, unfortunately, that most of the most of our wives or most of the ladies in the community, they are working. And that's why when the son of the family is sick, the mother, if the mother will sit with him at home, although she should, because he's sick and he's having 40-degree temperature, and she knows it might be a flu, it might be any other thing. If she will sit with him, she will lose 1 day from work. So this child, unfortunately, is given Brufen or paracetamol or any other thing, and he is sent to nursery or to school. Instead of sitting at home and the mother sitting or to find a way how to let him not to go to school, he is sent there, and from there the spread of the virus which the child is having. We come back to the same what you have said. It is the public education. It is how the people should be trained. Of course, the company should be a little bit flexible. If the mother will say that my son is sick, I mean, I should stay with him, there should be an excuse for that to avoid the spread of the viruses and the infection in the society and the community.
Yes, I totally agree with Dr. Mazin. I would like to also add in another point there. I think the support of leadership is also very important in this role. Yes, during pandemic, we did see thousands of posters coming up in the sky, but all of a sudden we see a decrease in all this awareness. Why? Because the leadership role does not step up all the time. I think once somebody is in the leadership role, you have to step up and inform everybody that this is the way to prevent things. So that's why the first quote that Dr. Mazin has told us during the first thing was prevention is better than cure. So also, from public awareness, leadership, this is two things that will combine together to give quality of life. So I do also want everybody that's sitting in this crowd, if you see there is a decrease in awareness in public health, please speak up on this, because this is important. If we do not speak up, nobody is going to speak up for us, because maybe somebody else is getting sick, but remember this, that somebody else could infect us also, or infect our family members also.
Yes, thank you. I agree with you totally. And this is what we have been discussing a while ago, to retain those habits. I think if the baseline for the minimum level of protection and hygiene level before the pandemic was, let's say, 30%, and it shoots up during the pandemic to 90, it shouldn't come back to 30. I think we should go back to 50 or 60 or 70. And also from financial perspective, and I think it has, those need to be part of the regulation. World Health Organization, the country system, healthcare systems, I think for now, if COVID-19 pandemic is over, the risk of having more severe and dangerous pandemic may happen. So we need to minimize the risk of getting into those circumstances by capitalizing and learning those lessons that we have been all facing, and probably imposing these measures and procedures as part of the system and healthcare regulations. If throwing a chewing gum in Singapore, at a point of time, you have to pay a fine. I'm not sure if that's still there, yes. But I believe that is becoming part of the individual's culture. And belief. Just like for us, like wearing the seat belts back years was not really mandatory by law, and I was not obeying about that. Now I wear seat belts all over, even if I'm going off-road deserts. Even if I'm sitting, it became part of my habits. We need to capitalize on those habits. And my personal belief, you may disagree with me, but this needs to be imposed and become part of the law, at least for further few years, until the next generation absorbs those habits and are becoming really part of their daily, usual, minimum requirement level of maintaining hygiene level. So this is very important. Thank you for raising this up.
May I add in something? When I told about speak up, I would like to highlight something. According to WHO, the low-income countries right now is only having 9% hand hygiene rates. the high earning income countries are rarely touching 70%. So can you see the difference? Why diseases are spreading? Our hands are the culprits. So this is where we start from. Okay, and we start this from home, we start this from school, we start this from workplaces. And we kindly observe your environments. That's very important.
This is great. I mean, if there is no other question, then I hope we could we could deliver, the message how to follow the proper hygiene and how to sustain it, how to follow up. Hygiene is hygiene. It doesn't belong to a certain period of time. It doesn't belong to certain disease. Hygiene is hygiene, should be followed to be able to fight against diseases, against viruses, and to assure a healthy, disease-free community, inshallah. Thank you very much for listening, and thanks to my colleagues who could deliver the same message to you as well. Thank you very much.
Thank you very much. Fantastic discussion. It's true, we need to make everything back part of the law again, like when the airports and the airlines made it mandatory to wear a mask. I don't know what happened to that law, but that was a perfect law, and now we're sitting in airplanes filled with people sneezing and coughing. Well, thank you. Thank you very much. Okay. Moving forward, it's time to recognize once again the great efforts of our healthcare professionals that have made a difference. So let us highlight them for their hard work and their contributions to the trendsetters that we have in the room today. So to present the awards, I would like to call upon Dr. Michael Connor, CEO of Agile Evolutionary Group, to present the awards on stage here with me. Dr. Connor. Okay, and so we shall begin with Ali Lamouri. Hold on to it for Ali. Next up, Ashutosh Singh. Congratulations. Ashutosh is the Chief SUA Officer at Patanjali Japan Foundation, a leading yoga practitioner with 25 years of experience. He has conducted over 300 awareness programs, collaborated with the Embassy of India, Japan, and local governments, and provided online yoga programs during the pandemic. Congratulations, Ashutosh. Would you like to share a few words with us? I believe the microphone is there.
Thank you.
Yeah, it's
Can you
on.
hear me?
It's on.
Okay.
Yes.
Thank you, thank you, thank you. Thank you so much. First of all, thank you to the organizers, Health 2.0, to organize such a wonderful conference and bringing up so many industry leaders together at one platform. And I'm very much honored to receive this award. And thank you and congratulations to all other winners. I dedicate this award to my parents and my teachers who molded me in such a way that I can think about society. And this award is giving me more sense of responsibility so that I can work more towards making a better organization and also create future leaders who can also think about society. My mission is to make zero stress, zero depression, and zero suicide Japanese society. By the power of routine, a better routine can make a better lifestyle, and a better lifestyle can lead to a better life. Let's explore. Let's go back to the basics and explore the treasure of ancient science. Let's do some research about it and trying to implement the knowledge our ancestors already gave to us and include in our daily routine. Thank you very much. Arigato gozaimasu.
Arigato. Thank you, Ashutosh. Well said. Ashutosh will lead us into a yoga session tomorrow morning. Next, we have Atsushi Tagiguchi. Present. Come on up. Atsushi is the sales director of Japan at Vision RT Limited, a leader in markerless, tattooless treatment for safer and more accurate radiation therapy. With over 20 years of experience in the medical device industry, he has successfully developed markets and achieved sales milestones. Congratulations, Mr. Tagiguchi-san. Would you like to share a few words?
First of all, thank you very much for giving me such a great opportunity to receive this award. I was so happy to receive this one, of course. Then, I was so surprised very beginning of this opportunity because I was nominated as one of the candidates of this award. And thanks again, finally, I was selected as one of the award receiver, Then maybe most of all, you are coming here to receive this award, right? Then maybe second reason to join this meeting is to expand your network. That is why please send me any invitation for LinkedIn to expand your network. I'm so happy to open your proposal. I'm happy to connect with your invitation anyway. Then to help patient, to help hospital, I will be happy to work for this health industry. Thank you so much.
Thank you. Congratulations again. Yes, please do take a stroll onto LinkedIn and see the conversations that are happening there now. All right. Next up, we have an award for Mr. David Golding. David is the founder and CEO of Sober Lifestyle Coaching, the UAE's first certified recovery mentor and sober companion. With personal experience of addiction and recovery, he is dedicated to reducing the stigma surrounding addiction and helping individuals struggle with alcohol, drug, and gambling addictions. Congratulations, David.
Bless you, Michael, and thank you so much to everybody else. My name is David Golding. I'm a father, a husband, I'm an entrepreneur. I'm also a recovering alcoholic, cocaine addict, and gambling addict. And I had a company that gave me so much wealth, I didn't know how to cope with life. And it nearly killed me. But I found recovery, and I love working in the recovery space. I love working with people who are suffering from addiction. And it's my mandate to go now and work in the UAE to help people suffering from addiction. There's 10 million people here, and there's a lot of people suffering, and we don't often talk about it, and we've heard today about mental health. There's also addiction, but I want to say that we can recover, and there's people here to help, and I would love to do that. Hopefully this year I'm going to open a day hub with my business partner, Dr. David Lee, and it's a day hub which is a non-residential recovery facility. It doesn't exist in the UAE. So hopefully with your support, we can achieve that thing. Thank you so much.
Wow. Thank you, David. That was fantastic. Thank you for your contribution. Definitely earned your spot on this stage. All right. Next, please put your hands together for Feroza Dawood. She's the head of department, obstetrician and gynecologist at Mediclinic Airport Road in Abu Dhabi. And she's a distinguished British consultant, obstetrician and gynecologist, internationally recognized for her expertise in recurrent miscarriage. She continues to contribute to the field with her extensive research and involvement enhancing maternity services across the UAE. Congratulations, doctor.
Thank you so much. I feel very honored to have received this award. I'd like to also congratulate all the other awardees, and congratulations to the organizers for this impressive networking of healthcare providers, industry leaders in marketing, insurance, finance, and IT. A wonderful, wonderful event. Thank you very much indeed.
Thank you. The team who put it together right there in Infinium Events. Let's give them a hand of applause. Woo! All right. Next up, we have an award for Jen Kinoshita. Jen is the head of R&D Japan at Virbac, Japan, with extensive experience in the pharmaceutical industry and academia. He plays a vital role in global innovative projects, specializing in commercial and technological licensing in Gen and veterinarian and certified veterinary cardiologist. He contributed to the success of legendary compounds in the animal health industry. Congratulations, Mr. Kinoshita-san.
Thank you very much for this recognition today. So I'm a veterinarian working for Virbac, French pharmaceutical companies dedicated to animal health. Both partnership and collaboration, that's a key for success to meet the challenges for us. So I strongly believe that our R&D activities can contribute much more to the human health industries.
Thank you.
I'm very happy to be here. Thank you so much.
Thank you, sir. All right. Let's give it for Mr. Kevin Miller. All right, we'll hold on to it for Mr. Miller. Mr. Nasser Al-Riyami. We'll hold on to it for Mr. Nasser as well. All right. Niru Baran. There he is. Niru Baran is the director at OmniHealth, a leading healthcare automation company in Southeast Asia and the Indian subcontinent, with a focusing on leveraging cutting-edge technology and automation solution. He leads a dynamic team dedicated to enhancing patient care, optimizing efficiency, and transforming the healthcare landscape. Congratulations, Mr. Baran. Would you like to share a few words?
Thank you, Health Art 2.0, for this recognition. I'm humbled and honored to be recognized among the healthcare industry leaders here. In OmniHealth, Singapore, we started as a pharmacy automation company, and then we grew to be a healthcare automation company in the region. In OmniHealth, we help healthcare industry and clinics to enhance patient care through operational efficiency. Thank you, and I'm very happy to be here this conference and looking forward for 2 more days. Thanks.
Thank you so much, Mr. Baran, for your contributions. All right, next we have an award for Mr. Ranjit Ranbor. There he is. Ranjit is a scientific advisor at Pergament and Cepeda, renowned for expertise in pharmaceutical sciences and biotech. With 18 years of experience, an MS in pharmacy and PhD from IIT Bombay, Dr. Ranbor excels in technology evaluations, patent invalidation, and collaborations with multinational corporations like Merck, Sanofi, and Milan. Congratulations, doctor. A few words.
Yeah, kind of jet lagged, traveling from New York to Dubai. But I must say because of whom I am here, to my gurus, my family, friends, and all the teachers. And I must thank organizers for making this happen, and to the Almighty. Thank you so much.
Thank you, doctor. Thank you and congratulations. Seichi Arikawa. Yes. Mr. Seichi is the new business development manager of Takeyama. With a focus on spreading safe surgical techniques, Seichi has dedicated his career to improving the medical industry, passionate about regenerative medicine and its potential to treat incurable diseases. Congratulations, Mr. Seichi-san. Would you like to say a few words? Paparazzi.
Thank you so much. I'm Seiichi Arikawa from Takeyama Company Limited, based on Hokkaido in Japan. Our company provides a lot of medical device, medical equipment, medical service for many hospitals and private clinics. I'm so happy now and very exciting. I want to thank organizers for Health 2.0 conference, judges for selecting me such a great this award. I also want to thank my colleagues, my teammates, and mentors for their great support and guidance. Without them, I wouldn't be standing here now. Most importantly, I want to thank my family and my friends. They are always believing in me and pushing me to be best myself. Thank you so much.
Thank you, doctor, and congratulations on your hard work. All right, next we have Theodoros Kravas. Come on up. Mr. Kravas is the country CEO of Afidia, the largest provider of diagnostic imaging services in Europe. With 14 years of experience in healthcare and management positions, he has successfully led the Spanish operations of Afidia since 2018. Under his leadership, Afidia Spain has achieved substantial growth, improved medical outcomes, and obtained multiple accreditations in clinical and quality standards. Congratulations, Mr. Kravas.
Good afternoon. It's an honor to be here today. As a speaker in the morning mentioned, recognition is something very important because it pushes us to do the extra mile, to fuel our ambition on how we can move things forward. I'm very glad to be here because today I was able to listen to all these very interesting topics from all the experts to understand the different point of view of leaders from every spectrum of the healthcare ecosystem, which is very, very important to understand and collaborate in order to move healthcare forward. Thank you very much for the organization and the recognition also for you for all this fantastic organization and the topics. Thank you very much.
Thank you, Mr. Kravas. Gracias. And last but not least, Shaz Mahmood. Shaz is the director of Medijourn, a dynamic, performance-oriented Indian entrepreneur and humanitarian. He founded Medijourn in 2019 to transform the medical value travel industry and make India a healthcare hub. In addition, he is venturing into the medical manufacturing sector, setting up India's first nitrile glove manufacturing facility. Congratulations, Mr. Shaz Mahmood.
Thank you, Health 2.0, for this recognition. It's a pleasure, and I hope to connect with all of you over the next 2 days. I come from India. It's 1/6 of the world's population, currently the world's most populated country. We've got our own set of issues, troubles, just like the rest of the world. But I think I'll like everyone here, especially from healthcare, to take a moment and pause and give yourselves a round of applause. Because for everything that we do, we are impacting good health and well-being. And forums like these, discussion groups like these, make it worthwhile. So let's hope for a healthier, happier world, and I hope to interact with all of you. Thank you.
Thank you very much, Mr. Mahmood. Thank you and congratulations. Yes, this is definitely the platform. Dr. Connor, thank you for joining me on stage and for getting your steps in today. And congratulations to all the awardees who have been recognized for their selfless dedication and their invaluable contributions. So I just want to remind you, you've taken a lot of pictures of yourselves here getting awards. Please post them and hashtag health2conf. Health, the number 2, conf. And we would love to see these on Twitter, LinkedIn, and so on. All right, so we shall reconvene here tomorrow morning. It's been a fantastic start to this conference. Have a lovely evening, and we'll see you tomorrow. Thank you.